Today is very nice to have, it is sunshine, but there is a little bit cloud here and there. But it's nice to have you all here in the mini conference from the Universitas Gadjah Mada and also Groningen University. And today we will have the mini conference, which quite dense though, but we will be nice because we will have quite a lot of information and to be shared and also research to be shared, and then we can learn from one to another. Ladies and gentlemen, I'm Azam Saifullah. I'm the MC for today's occasion from this morning up until 6 maybe, but no worries. We'll have fun today. So we'll have quite a lot, and with us here is the Vice Dean of Collaboration, Alumni, and also Community Services, Dr. Sudadi, with us here, and then we will have so many others will join on soon, and also the team from the Groningen University, which is will see one another. And I'm sure that you already discussed something in the matchmaking session, so it will be fun to have everything to be shared here, especially for the research part. Ladies and gentlemen, for today's occasion, it will be some parts that I will mention before we start for the session. The first things we'll together we'll see the safety briefing video, and then continue by the opening remarks, and we'll have the mini conference from faculty to faculty. So we'll have quite a lot of faculty members to join in and also share their expertise. And without any further ado, the first one we'll see together and watch together the safety briefing video, please.
Selamat datang di Gedung Pascasarjana Tahir Foundation, Fakultas Kedokteran, Kesehatan Masyarakat dan Keperawatan Universitas Gadjah Mada. Sesuai peraturan perundang-undangan terkait keselamatan dan kesehatan kerja, maka kami wajib memberitahukan tentang prosedur keselamatan saat keadaan darurat. Gedung Pascasarjana Tahir Foundation terdiri dari 8 lantai dan terbagi dalam 2 bagian, sisi utara dan sisi selatan. Seluruh lantai di gedung ini dilengkapi dengan fasilitas dan peralatan untuk keadaan darurat, seperti pintu darurat, tangga darurat, alat pemadam api ringan atau APAR, fire hydrant, heat detector, dan fire sprinkles. Saat ini, Anda berada di ruangan auditorium lantai 8 yang terletak di sisi utara gedung. Jika terjadi bencana alam atau keadaan darurat lainnya, maka tanda keadaan darurat akan berbunyi. Segera ikuti panduan evakuasi sebagai berikut. Segera tinggalkan ruangan dan cobalah untuk tenang serta tidak panik. Menuju pintu darurat yang berwarna oranye, terletak tepat di depan ruangan ini. Berjalanlah dengan cepat, namun jangan berlari. Jangan menggunakan lift. Lepas sepatu yang bertumit tinggi. Gunakan tangga darurat dan pegang handrail. Turunlah dengan tertib dan jangan saling mendorong. Utamakan wanita hamil, lansia, dan difabel. Dalam keadaan gempa bumi, berlindunglah di bawah perabot yang kokoh dan tunggu sampai gempa benar-benar berhenti. Jika Anda melihat kebakaran, segera informasikan ke tim tanggap darurat. Jika memungkinkan, segera padamkan api dengan APAR. Namun, jika tidak memungkinkan, segera lakukan evakuasi. Ikuti arahan petugas tanggap darurat menuju titik kumpul. Dan jangan mencoba untuk kembali ke dalam gedung. Dengan mengetahui safety introduction sejak awal, maka kita dapat meminimalisir angka kecelakaan saat keadaan darurat demi keamanan dan keselamatan bersama.
We're very sorry that there's no English subtitle there, but at least you know now that you are in a 8th floor of this building, which is the northern part of the building. So just like in the video, if something happened today, we'll have no trial for the things. But if something happens, we can go through the door and then go straight to the red doors in front of this room, so it's pretty easy for us here. And so I think that's pretty easy because we're used to things that happen. But don't worry, we don't have that notice, so we're fine. We're fine. And again, to open this session, we'll have the opening remarks for this mini conference, which will be delivered by Vice Dean for Collaboration, Alumni, and also Community Services, Faculty of Medicine, Public Health and Nursing, Universitas Gadjah Mada. Please, Dr. Sudadi.
Assalamualaikum warahmatullahi wabarakatuh. Good afternoon, everyone. On behalf of Faculty of Medicine, Public Health and Nursing, I would like to extend a hearty welcome to all our distinguished guests for this mini conference. Delegates from the University of Groningen, Vice Dean from all relevant faculties, lecturers and researchers from the Faculty of Medicine, Public Health and Nursing, FK-KMK, Faculty of Pharmacy, and Faculty of Dentistry, FKK. We are thrilled to have future students, current students, and estimated alumni joining us today. Universitas Gadjah Mada and the University of Groningen, the Netherlands, have established a strong partnership in education and research over the past several years. Various collaborative programs such as joint research, student mobility, and academic exchange programs have strengthened the academic relationship between the two institutions. This mini-conference is held to strengthen this collaborative network and open up the new opportunities for collaboration in research and education, bringing together representatives from the universities, including lecturers, students, and alumni. This event provides a platform to share the latest research developments, discuss opportunities for future study at the University of Groningen, and explore various forms of academic and professional collaborations. The purposes of this conference are strengthening collaborative between UGM and University of Groningen in research and education, presenting research presentation of University of Groningen doctoral student from UGM, connecting and seeking prospective doctoral for the supervisor at University of Groningen, providing a forum for University of Groningen alumni to share experience and opportunities for future collaborations, and encouraging UGM lecturers to network and collaborate with researchers at Groningen, discussing potential programs such internships, fellowships, student and staff mobility, and visiting scholar programs between two universities. The expected accomplishment of this mini-conference, establishment of stronger researcher and education network between UGM and Groningen, identification of potential research topics for future collaborations, formulation of a follow-up plan, MOU, joint proposal, or mobility agreement, increase interest of UGM students and lecturers in academic program at Groningen. This intended participant for all this mini-conference are lecturers and researchers from the Faculty of Medicine, Public Health and Nursing, Faculty of Pharmacy, and Faculty of Dentistry of Gajah Mada University. UGM doctoral student currently studying at the University of Groningen. Prospective UGM doctoral students interest in continuing the studies at Groningen. University Groningen alumni from UGM. Representative of the University of Groningen and student and academic staff interest in international collaboration opportunities. This event is a remarkable opportunity to connect, share ideas, and inspire one another. To the future student, you are about to embark on an incredible journey. To our current student, keep pushing boundaries and exploring your passion. And to our alumni, thank for the being ambassador of the University of Groningen value and excellence and sharing with us. Let's make the most of this event, engage, learn and build network, enjoy the discussion, conference and each other company. Wassalamualaikum warahmatullahi wabarakatuh.
Thank you for the opening remarks for this mini conference. Well, it's mini, but not that mini actually, because we have three faculty that join in together. The first faculty will be the Faculty of Pharmacy, and then continue by the Faculty of Medicine and Public Health and also Nursing, and then the last one is Faculty of Dentistry. However, before we start the mini conference, which is not that mini, we call it just conference, isn't it? So to start this conference, we have the opening remark, but we will have we'll very proudly to have John Valdi here to listen to him about the brief information about the collaboration of the Universitas Gajah Mada and UG-Hub. So we will have learn more about the UGM and also UG-Hub, and it will be delivered by John Valdi, which is the International Policy Advisor from University of Groningen. Please welcome John Valdi.
Yeah. Oh, yeah. Okay. Hi, everybody. So before we get into the main part of the afternoon, I just wanted to give a quick overview of where we are with the UGM hub. Many of you would probably have heard of this spoken about over the past year or two. And not much has happened yet. A few small things have happened. Actually, we are kind of considering this afternoon as one of the first events as part of the hub. But I wanted to kind of recap where we've come from over the past couple of years, where we are now, and what we would like to do in the coming year and years. I do have a presentation. Oh yeah, there it is. Great. So I'm gonna, it's quite long, but I'll kind of skip through it a little bit quickly so that I don't take up too much time. But yeah, So as I said, I want to recap over what we've achieved so far, but then also to kind of go back to the word hub and think, okay, what are we actually talking about here? And then to think about what we need to do to make the next steps and how we can actually begin together to actually realize what we've been planning. So of course we have a really firm foundation, one of which is our wonderful group of alumni, which is one of our greatest strengths in our collaboration. You can see many familiar faces on this screen, some of whom are in the room. This is really a fantastic foundation for our collaboration and something that we see as something we can use in order to improve even further. This has enabled us to do a number of things over recent years, so you can see a selection here. I haven't put any, I was going to try and put some photos from this trip into the, there are many photos, there's hundreds of photos I think have been taken, but these are some photos of recent interactions between our two universities over recent years. Yeah, there's a whole range of things that we are doing at the moment all over the university. Double degrees, but also all kinds of other collaboration, student exchange and research. I won't read all of it out. But all of this made us kind of go to the kind of drawing table and think about, okay, let's try to create a kind of plan, a strategic focus in all of these things that are happening. And that resulted in what we called, I think we named this about 18 months ago or 2 years ago, the Hub for Future Human Welfare. So this was what we came up with when we compared the strategic plans of both of our universities. And we came up with these 5 main pillars for how to kind of group our research. The idea was that we would be able to work together to strengthen research in these particular fields, which is strategic for both of us, but also for our governments, and then also be able to go and get external funding to fund further collaboration. This was already quite a while ago, and yeah, so we've accomplished quite a lot already. We have a really firm foundation. So the top-down kind of thematic plan that I just showed you, the group of fantastic alumni, some of whom are in the room. We have a lot of mutual understanding and knowledge about each other's institutions. That's not something you get with all university partners, so we're really lucky to have that. And of course, it's been, many people have worked very hard over the decades to get to this place. We also have the support from both of our governments and a lot of willingness on both sides to do more. And we even have actually briefly discussed, not so concrete yet, but we've even talked about opening mutual offices on each other's campuses to kind of get things moving even further. But how do we actually turn all of these kind of quite, cloud ideas into something real and tangible? How do we operationalize it? So maybe let's go back to what we actually mean by hub. And actually, a hub can be many different things. So we're not trying to be too specific with this. There's lots of examples of different things that are going on. So for example, at our university, we have a couple of different things that we're doing with other strategic partners, which we could look at and think about whether that would work here. But it really depends on what will work for both of us. We have to come to a mutual decision about that together. But broadly, a hub should be a kind of focal point for the collaboration itself. So it can be digital, so shared resources, shared services and communications. It can be physical in the form of an actual teaching space or an office somewhere here on the UGM campus or somewhere in Groningen. Or it can be organizational, so we could think about creating some kind of department which is jointly held between the two universities. But basically, it's supposed to be the home of our collaboration. So if you want to know more about what's going on, if you want to know what the options are, then you should know where you can go, who you can talk to ask. And it's really dedicated 100% to the maintenance of our collaboration and the planning for the future together. So we have a whole range of things which we're doing at the moment, which we could see as being part of this hub. So there's a bit of a focus at the moment, I think, on PhD, and particularly on double PhD. That's one of our priorities. And so moments like this are really important, where we can make matches between new researchers, but also because our collaboration is so mature, if I could say so, it's we have a lot of mature collaborators. So we have people who are already nearing retirement, and we need to make a sensible kind of handover of the collaboration to a new generation. And that takes planning, and that takes work. So yeah, there's lots of kind of support that a hub could offer to all of this. Some examples of that are listed at the bottom, but we shouldn't be restricted to this. But for example, in May, that was the last time I was here at UGM. We held a pre-doctoral training course. It was the first time we did that, just us two universities. We have done this before with a number of other Dutch universities, I think 2 years ago. But that collaboration ended, and we really see UGM as a good partner in this. But this is a course for incoming PhDs from Indonesia to our university to kind of prepare them for all of the things that we know, like the culture shocks and the changes, the differences between our two systems. So we had the first one this year, and we'd like to continue that in future years, and we'd like to grow it, to offer it to more and more, as many incoming PhDs as possible. Another one is not actually happening yet, but we're talking about ideas for it, and that's a workshop for supervisors on either side who are, so for example, supervisors in Groningen who maybe they haven't had an Indonesian PhD student before, they don't understand fully how maybe LPDP works, for example, and we can have some kind of sharing of knowledge about how to be successful in that, and what kind of thing is involved in that. So maybe that's something we can look at for next year. So another one is this conference, or mini conference, or not so mini conference, but it's a way for bringing people together and sharing best practices, but also making new connections. Last summer we had, this conference is broadly health themed. Last summer we were here with a number of our colleagues from the Faculty of Engineering, where we had a hydrogen research summer school, but it was kind of more like a conference, really. So opportunities like this are what we could see as part of the hub. They take a lot of organization, and it would be great to have a hub to support this. There's a whole range of future objectives, and these are maybe something we could see as for the longer term, so 5 to 10 years. But yeah, and I think also something that we ought to discuss based on our mutual interests. And I think we should be really creative here. So who does what? How do we actually get things started? Who needs to do what? So I've mentioned our alumni, many of whom are in the room, but what's the role of alumni here? What's the role of our colleagues who are in the room from the faculties, academic staff? What's the role of our mutual leaderships in this? What's the role for people like me and my colleagues in the UGM Office of International Affairs? How can we support this? But also, if we're talking about a hub, would there be anybody actually located in the hub, working permanently for the hub? And how would that work, having dedicated staff? Who would they be? How would they work? And what would their role be? We have, this is another old slide from the past couple of years. So these are kind of broadly our ambassadors for the collaboration, many of who, well, Martin, you can see maybe photo of you on the screen there. But also we have other of our professors here, and your kind of corresponding professors who are working together on improving the collaboration. But actually what I'd like to do is establish more of a working group for the hub. So actually I've called it a dream team, but like I'm really interested in finding a group of invested alumni who are really interested in taking the next steps in our collaboration. So people who know UGM well and also have spent time in Groningen. To begin answering some of the major questions around the hub and how we can shape it together. So what do we need to do now in order to get off the ground, and what kind of thing can come later? So what kind of thing can we leave until another time. But what does it actually look like? What are the elements, the physical elements, the digital elements, and the organizational elements that we need to decide on? Also to look at existing examples, success stories in other parts of the world, and think about what that means for our collaboration and whether we would be interested in doing the same or maybe not interested in doing the same. And then ultimately to come up with a more solid operationalized plan for how to take the next steps with the hub and a kind of roadmap for the next 3, 5, 10 years, let's say. So I wanted to leave that, this is the end of my presentation now, I wanted to leave it kind of in the back of your mind before we move on to the more content-heavy part of the afternoon. I'll be here for the rest of the afternoon, and also you can email me if you have any ideas. But for the meantime, that's it. Thank you so much, and I hope you enjoy the afternoon. Thanks.
Thank you. And now we come to that not so mini conference, which is started by the Faculty of Pharmacy, and this session, which is the conference by Faculty of Pharmacy, will be moderated by Professor Jarir Thobari. And ladies and gentlemen, please welcome Professor Jarir Thobari.
Okay, good afternoon, and thank you everyone to be here. I think there's so many familiar faces. Colleague from Faculty of Pharmacy, Faculty of Medicine, Public Health Nursing, and also from dentistry. So the idea of this conference, of course, is to see what's going on in terms of the collaboration between University of Gadjah Mada and Groningen University, especially for the students who work very hard for their thesis in Groningen, current students and alumni, so meaning that the one that already finished, and we would like to understand are there any continuation of the study, are there any new initiative come up, and then also to hear also from the future student who I think already have a matchmaking this morning, or is already have a matchmaking in the past, yeah, because it's going to start it soon as possible. So this is the idea. And then the other colleague who are attending here also to understand what the project is ongoing or in the past, so they also can have the idea of us whether we can have a more collaboration, continuation of the study, or this is similar kind of type of research that we can do together. So this is the idea. So we hope that in future this kind of mini conference can be continued. Of course, maybe in future we're going to also asking a lot of researchers, not only alumni students or future students, maybe also the colleague who want to do collaboration research with the Groningen University can also presenting their study. So I would like to invite, there are 6 presentation from Faculty of Pharmacy. 2 of them will be online because they are current students. They are in Groningen, and I hope it's not too early for you. This is 7 o'clock in the morning now. Yeah, but if you want to what you call that, not put it your face in the Zoom is fine. Yeah, I know maybe you not have a bath or shower yet. So first, I think I'd like to invite Farida Nur Aziza. and Fathul, Muin, they are actually future student. So they're going to present something that what they're going to do. Alumni, Niken, Widyakusuma, and also Rifqi Rokhman. That's just recently graduated. And then the current student who are still working in the Groningen, Arif Nur Ihsan and Maya Ramadhani Indarto. So the way that we present is everybody have to be presenting 5 minutes, and then this will continue until the last presentation from the Faculty of Pharmacy. And then we have some times to discuss. Discussion could come up from audience, but we like to asking also for our guests from Groningen to give also, is there any something similar that also can be done again in the future. Okay, that's first Farida Nur Aziza. Yeah. And then 5 minutes after that, followed by Fathul Muin, and both of them are from future student. Yeah, it's your time. The slide, yeah.
All right, good afternoon, everyone. So I'm Farida Nur Aziza. I'm from Faculty of Pharmacy, from the Department of Pharmaceutics, from the Pharmaceutical Technology Lab. So thank you for the beginning that I can stand here and in front of you to tell about what I did before and then what's my plan for my future research. Hopefully I'm to be a future student in Groningen, but unfortunately I cannot attend the matchmaking in this morning. So hopefully maybe some of you here from the Groningen can relate with my topics later. All right, so next, yeah, for the slides. All right. Yeah. For today's presentation, I would like to tell about the exploring the formulation technology in a drug development. Okay, so what I did before, basically I had experience in the pharmaceutical industry around 5 years in production and quality assurance, and then I changed my career to the academic, and I'm here as a lecturer in pharmacy department. Then basically I had a background research on GMP, so we had a lot research experience in the pharmacy to have a GMP research with how it is implemented in the pharmaceutical industry. And then also I also teaching and guiding students in some research related with the formulation. That one of the current research that I did and then currently still in progress is the how to find the alternative for the capsule cavity or the capsule shell. Basically we had before in gelatin, right, until now, and then we try to overlook any alternative for the substitute or the alternative for the capsule cavity from the natural formulation that now currently we use sago starch and also cornstarch and garut, and currently we had a good progress that some of the formulation succeed to formulate a good shell or good capsule cavity. And then also I had some research related with the formulation with the natural ingredients such as the oyster mushroom, Pleurotus austriatus here, because we have oat formulation in Australia, for example, they have oat from the oat, and then we change in Indonesia because we don't have oat. Now we try to find any alternative using the oyster mushroom. And then also the other is to find the formulation about the formulate on floating tablet and then also fast disintegrating tablet. Then we also to find out the alternative excipients that we can use for the filler binders. And then also we have research about the natural oil and also essential oil. Then on the product development, we try to formulate into some preparation into gel, and then lotion, and also some of cosmetic ingredients. Sorry, this is the current research that we had on capsule cavity, and also for the formulation in some pharmaceutical dosage form. And the right one is the MCC, or the microcrystalline cellulose from the Siwalan fiber that we use for the alternative excipients for the floating tablet or the fast disintegrating tablet. All right. Now I will move on to the research interest that I want to do for my PhD. This one is about the 3D printing. The first one is about the 3D printing, how we can formulate the SNETs, and we combine it with the rifampicin and other TB drugs. So I will focusing on the TB drug development that we embed, or we collaborate, we combine it with the SNETs, and then we print it into the ink, we mix with the ink polymer to be the 3D printing formulation. And then after that, we will do the characterization and also the in vitro evaluation for checking the bioavailability profile. And then the one that I still not include in this slide, because I just add one more research interest that I really interested now is on extracellular vesicle, or EV, because now it is developing, right? And then I have an interest, and also we had the research in our lab under Dr. Ronnie Martin lab. We have the nanoparticle research and also the extracellular vesicle, and especially an exosome, to combine it with the alternative for scars and wound healing, and also for the wound healing, and also the other medication. So that's two research interests that I want to discuss maybe later with the Groningen, for further research topic that maybe I can do for my PhD research. Yes. Okay. I think that's all for me. Thank you for the opportunity. Hopefully we can talk later with the Groningen University. Thank you. Good afternoon.
Good afternoon. Yeah, thank you, Farida, for your quick presentation. Second, Fathul Muin.
Okay, bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Okay, first of all, thank you very much for the opportunity that given to me. My name is Fathul Muin. I'm a member of Pharmaceutical Management and Community Pharmacy Laboratory in the Department of Pharmaceutics, Faculty of Pharmacy, Universitas Gadjah Mada. Today, I will present related to access and control in the management of essential pain medicines, which is my interest in the pharmaceutical management. So, okay, first, I want to explain about the main topic related to the essential pain medicines. What I mean essential pain medicines here related to the medicines for especially the analgesics from moderate to severe pain. As all we know that from research by Rustam Aji presented the result that access to essential pain medicines, particularly for opioid analgesics such as morphine, for moderate to severe pain remains limited in Indonesia. And this research output also related to INCB report that the levels of consumptions of opioids for pain relief in over 121 countries were inadequate or very inadequate. And another reported from Satya Budi and his college reported that Indonesia is one of the lowest country for the opioid consumption for pain relief, which only 0.054 milligrams per capita, which is placing Indonesia one of the lowest in globally, and this indicates that opiates are extremely underused for correct medications in Indonesia. From the control concerns, there is a strong concern from the governments about the potential of misuse and dependence from the opioid analgesics, and from WHO, overly restrictive control policies may hinder patients' right to adequate pain management, which is can reduce the right to the patients to obtain the correct medications. And unnecessary suffering caused by inaction and excessive administrative barriers reflects a public health failure that calls for urgent policy improvement. Okay, sorry. Okay, based on the screen, we can see that the pathways how the medicines can deliver to the patients, which is starting from the industry until to distributors, and then the pharmacies, to the practitioners, until in the patient. So we can see there is a lot of change for diversions there. So the governments need to make sure that there are no diversions in all of the pathways here. So the framework from my projections for the future study related to how to balancing these two major dimensions from the access and also from the control side. So from the first one, from the access dimensions, we need to make sure that the availability of medicines, including the supply chain and also the procurement until the health facility be available for the patients. And the second about the financial and administrative accessibility, which including the pricing, because some of these medications are licensing. So we need to make sure that the price is affordability to the patients, and also how the distribution. Sorry. The next is about the health workforce readiness related to the practitioners and also the pharmacists, how to make sure that they understand the use of such as the opioid analgesic to the patient, so they can provide that medications in their facility. And the control dimensions, of course, regulatory and licensing mechanisms from the Ministry of Health, the drug FDA, and also in national narcotic boards need to take concern in the regulatory and reporting and monitoring systems to make sure there are no diversions in all the supply chains, and how the compliance with prescription and dispensing standards, especially in the procedures that already standardized by the government. So what is the next from the study is first one to make the research directions, which is to explore how to achieve a balanced system that ensure access to essential pain medicines, especially the opioid analgesics medicines, while also maintaining appropriate control and oversight. And the conceptual development, policy inquiry, empirical explorations are currently underway. So for the proposal should to be perfect to the next stage. And this is the last slide. One of a framework that we can be implemented to the study is CFIR, which is a consolidated framework for implementation research, which is contain a lot of domain here. The first one is about the basic thing about the essential pain medicine, which is their evidence-based, design features, relative advantage, and so on. And the external from this side about the community needs. So we need to provide the data how many patients that actually need that medications. Also external policies related to the regulations from the overseas and aligning to Indonesian regulations, then regulatory pressures and also partnerships, and in internal settings, also resources, leadership support, internal communication, and so on, which drawing the individual's roles and also characteristics. And the last, the process from the planning, training, engagement, monitoring, and so on, to make sure that all the process from these regulations can be maintained, so the use of opioid analgesics or essential pain medicines can be used correctly by the patients, and also prevent the diversions. Yeah, I think that's all from my presentations. Thank you very much for your attention. Wassalamualaikum warahmatullahi wabarakatuh.
Fathul, for your presentation. You see, there are two current the future student. They have a very nice and very relevant idea of research, especially for Indonesian setting. One is addressing for innovation for the new drugs, and then the second is very important for public health need in Indonesia, and also for the policy of the painkiller. I think that we're going to discuss it later. So please, if you have some question or you have a remark, you can write it down. And then we invite Niken, Nur Widyakusuma, and after that Rifqi Rokhman for the alumni.
Okay, bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Good afternoon, everyone. I'm Niken. I'm one of the lecturer in Faculty of Pharmacy UGM. I'm one of the alumni from University of Groningen. I was graduate from my master degree in University of Groningen in 2015. So it's been like 10 years ago. I was in the Department of Pharmacoepidemiology and Pharmacoeconomy at that time with Prof. Alkohak at that time. He was my mentor. And for this mini conference, I would like to share my research idea about the effectiveness and safety of herbal medicines in chronic condition, a pharmacoepidemiological perspective. Yeah, I would like to start from the behavioral aspect, because in the past few years, actually, I've been studying about the medication taking behavior of chronic condition patient, such as hypertension or cardiovascular disease. The adherence to chronic disease treatment in Indonesian context, is influenced by herbal medicine use. We know that patients with hypertension use herbal medicine alongside conventional treatment, and that can influence their adherence to prescribed medication. And if the patient not taking the herbal medicines, usually family members may encourage patient with chronic condition to take herbal medicine instead of prescribed medicine. And the herbal medicine itself depend primarily on the self-diagnosis and self-treatment. And this is the concept of why people not taking antihypertensive drugs. And one of the factor is that these people perceive that herbal medication is enough. So the herbal medicine used vary from noni, anise, garlic, turmeric, propolis product, and unknown compound in jamu or other formulation used in traditional Chinese medicine. And many people perceive herbal medicine as safe, although it can be misleading because natural doesn't always mean safe. And herbal medicines may involve risks such as adverse effect, nephrotoxicity, hepatotoxicity, and interactions with the prescribed medicine. And so far, we, as the practitioner, usually recommend patients to give a 2-hour gap between the prescribed medicine and herbal medicines due to the lack of data regarding the effectiveness and safety of herbal medicine. So there is a significant need for public education on the potential risk associated with herbal medicine. So I would say this is the research opportunity or the challenge that we may answer. They are, what are the herbal medicine used? We need to know the type, dose, duration, and frequency, because we know that herbal medicine that is used usually doesn't always be in a final product that is used alongside chronic conditions such as the cardiovascular disease treatment. And then what are the potential risks associated with herbal medicine use in chronic condition treatment? And then to what extent are the potential risks of herbal medicine use in chronic condition treatment? To answer those questions, we may target the routine use of herbal medicine as complement to prescribed medicine and its effect, let's say, on liver function or renal function. And this is quite tricky. The possible data sources that available in Indonesia, probably we can take from the reconciliation data from pharmacy in a hospital or patient medical record from complementary or holistic or Diankes pelayanan kesehatan tradisional healthcare providers, or probably the product sales in pharmacy, product sales data from pharmacy. And if those data is not possible or not available, we should collect the primary data from patient, for example, from patient with cardiovascular disease. And then they are asked whether they took any herbal medicines in the preceding 30 days combined with the data from their medical record. And then we can do cohort or case control study. Yeah, so by answering those questions, I hope we can actually better address the public education need relating or regarding the potential risk of medication, herbal medicine use. Yeah, I think that's all from me because I only get 5 minutes.
Okay.
Thank you.
Thank you, Niken. Yeah, herbal medicine is one of the highest medicine use. Indonesia is one the country that use herbal medicine a lot. Okay, Rifqi, your time.
Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Good afternoon, everyone. It's an honor for me to meet with so many important representatives from University of Groningen, including my supervisor during my PhD, Prof. Martin Posma. And of course, I'm very happy to meet with several important person from Gadjah Mada University, including Prof. Jarir as my co-supervisor during my PhD. Okay, so for this mini conference, I would like to talk about the economic evaluation of non-communicable disease intervention, especially in Indonesia. Yeah, so as we know that non-communicable diseases accounts for 73% of death in Indonesia due to cardiovascular diseases, cancer, chronic respiratory diseases, diabetes, and etc. And this non-communicable disease associate with high cost and heavy disease burden. And with limited budget of national health insurance, of course, this non-communicable disease is becoming a major problem right now, and of course it will be a huge problem in the future. Therefore, this economic evaluation can help us to allocate our health resources more efficiently and also fairly. And to accelerate this process, our faculty has established VETA, Pharmacoeconomics and Health Technology Assessment. It's a research group, contains of around 12 lecturers or researchers, and I will talk about this VETA later. Okay, so this is my research experience. During my PhD, I evaluated about a risk score. So this risk score is used to screen undiagnosed diabetes and also people with dysglycemia. The instrument itself is named Finnish Diabetes Risk Score, or we call it FINRIS. And during this study, I worked together with Dr. Uri from Universitas Hasanuddin. And from this project, we know that this FINRIS can be used to evaluate not only people with undiagnosed diabetes or dyslipidemia, but also for people with metabolic syndrome. And the second, my research focus is about the quality of life measurement, especially about kidney disease quality of life. So this instrument is used to assess the quality of life of patients with dialysis. And the last one, of course, about cost effectiveness, especially the adopting of FINRIS to use as an instrument to screen people with undiagnosed diabetes in Indonesia. And right now we also have two projects. The first one is about cost effectiveness of bevacizumab for metastatic cervical cancer. It is funded by the Ministry of Health. And the second one, we also have cost effectiveness of community pharmacies for screening undiagnosed diabetes. This study is funded by Ministry of Education. Okay, I will skip this slide. So as part of this research project, so this research group right now is have collaboration with Ministry of Health, especially to evaluate the cost effectiveness of bevacizumab for metastatic cervical cancer. And also right now, some pharmaceutical companies also want to ask our help to evaluate the cost effectiveness of their product. So hopefully, if we can assess that their product is cost effective, their product can be covered by the national health insurance. And if not, of course, they have to lowering their prices. As a research group, we also want to find some research funding, and to some research funding, the requirement as usually is we have to have international collaboration. That's why I think it's very important to have collaboration with University of Groningen, not only for research funding, but also when we conducted the cost effectiveness, maybe from the Ministry of Health or also from pharmaceutical company. So if possible, we not only to have collaboration in research collaboration, but also maybe for capacity building and also for joint grant application. Thank you very much for this opportunity.
Yeah, thank you, Rifqi. Fantastic research, what you're doing, find the new tools for screening the diabetic with very simple screening method. And then also, you already continue for working group in your Faculty of Pharmacy with PEFTA, and then hope that collaboration with Groningen will be in future direction for your research group as well. So thank you. So the next two presentation is current student. I think this gonna be online. Arif Nur Ihsan, are you hear me?
Yeah, I can hear you clearly, Prof.
Okay,
Jarir.
you are there already. So, and then the second, Maya Ramadhani Indarto, I see you already there. Do you hear me? Yeah. Okay.
Yep, I can hear you clearly, Prof.
Okay, thank you for your early morning presentation. Thank you very much to join our conference. And I would like to give the Zoom to Arif Nur Ihsan first, and then followed by you, Maya. Thank you. You're welcome.
Yep.
Okay. Okay. Oke. Goedemiddag allemaal. Selamat siang Bapak Ibu sekalian. Assalamualaikum warahmatullahi wabarakatuh. And good afternoon everyone. So let me introduce myself. My name is Arif Nur Ihsan. Currently I'm a Ph.D. student in Faculty of Science and Engineering, University of Groningen. And I also a lecturer in Department of Pharmaceutics in Universitas Gadjah Mada in Faculty of Pharmacy. So it's been an honor for me to present my work now in front of you. So I will start. So basically, my project is the development of chikungunya vaccination through the novel vaccine formulation and the use of alternative administration route. So in brief, I try to enhance the stability of chikungunya vaccine and try to formulate another approach to deliver the vaccine. So can you proceed to the next slide, please? Yeah. Okay. Can you next until this slide is finished? Yeah. Yeah. Thank you. So chikungunya is a mosquito-borne disease. So basically, it is spread by mosquito, and it cause fever, joint pain, muscular pain. So basically, it's a common disease in tropical countries. Yeah, among others, malaria, dengue, and also West Nile and different kind of virus. If we compare the morbidity of chikungunya and malaria, it's it's just not that dangerous. But if you compare the infectious rate of the chikungunya is way more infectious than malaria. So there is no proven clinical studies about what kind of antivirus that can treat the chikungunya disease. So most of the treatment only treat the symptom, not really address the virus itself. So what I'm doing now is to do vaccine approach. Can you proceed to the next slide? Yeah. And another one, I think, yeah. One of the challenges during vaccination, especially in Indonesia, is you need to rely on cold chain distribution system. So basically, you rely on transporting vaccine product in one fridge to another fridge. It's really difficult in Indonesia because Indonesia consists of 6,000 islands, which most of the island is lack of electricity and lack of medical facility. So it's really hard to distribute the vaccine to the remote island in Indonesia. So I think that's the biggest challenge. And the second challenge is most the vaccine is delivered by intramuscular injection. So you need like trained medical staff. Yeah, like I mentioned before, that there is a limited facility in Indonesia. So basically, you cannot. You need to send the personnel as well to deliver to give the vaccine to the people. So that's also the other challenges in Indonesia. And the last thing is vaccination also produce infectious waste. If it's not treated properly, then it will become a problem also in the future. Next. Yeah, so what I'm doing now is I try to mimic how the mosquito deliver the virus. So mosquito, it's when mosquito bite us, basically it's just painless because somehow the probes or the needle of the mosquito did not pierce our nerve ending, so it's painless at all. And the mosquito inject the virus inside our below our stratum corneum, so it's in the adipose tissue. So somehow it's incubate in there, and that's why we mimic it. So we try to mimic how the mosquito deliver the virus. So we try to make a microneedle. So microneedle is basically a needle, but it's just very small and not very long, so it will not pierce the nerve ending, so it will painless procedure, and it also able to deposit the vaccine into our skin, which will enhance the innate immune response in skin. So can you proceed to the next slide? Yeah. Yeah, this is the overall concept of my research. So first we isolate the vaccine from the patient, and I'm trying to enhance the stability of the virus first using freeze drying, using different kind of protectant. So in this case, I use different kind of sugar to protect the vaccine during the process, because we want to remove the water content in the vaccine. So basically, in this case, we're gonna make dry powdered vaccine. And if it works, I tried. If it works and the stability is improved, and we can determine the stability by using ELISA, SDS page, also particle analysis, and also in vivo testing. And if it works, then we can proceed to formulate the microneedle in here. And also we will test the microneedle. So the purpose of this study is to allow self-administration. So people don't have to, I mean, every people can use their own vaccine. So it's like a patch-based vaccine. So it's like a plaster or Band-Aid, but there is a vaccine in there. So people can use themselves. There is no need of trained medical staff to help and administer the vaccine, and that's the idea. Which is, I believe it's really beneficial for Indonesia, because we lack of medical staff, also we lack of electricity, and also the cold distribution system. So I think this research gonna be really beneficial in Indonesia if it can be applied in the real situation. Can you proceed the last one? Yeah, thank you. I will say thank you for the University of Groningen for this opportunity, and also my scholarship, LPDP. So thank you.
Yeah, thank you, Arif. I think that your study is very innovative, and can you stay a bit longer, because after this we're going to have a discussion, right? Yeah.
Absolutely.
Okay, so Maya, could you proceed for next presentation? Yes.
Okay. Thank you, Professor Jarir, for the opportunities, and hello everyone. Good afternoon and goedemiddag. Can go to my slide, please? Yeah. Oh. No, I think it's still Arif's presentation. So, yeah, I will introduce myself. Yeah, my name is Maya Ramadhani. I'm a PhD student from Department of Pharmaceutical Analysis, Faculty of Pharmacy, University of Groningen. And I started my PhD in September 2025. So this year I've been 3 months in Groningen, and during my 4 years PhD, I will be supervised by Professor Dr. Danto and Dr. Paula Mian. They are both clinical pharmacologists and toxicologists from Department of Clinical Pharmacy and Pharmacology, Faculty of Medicine, University of Groningen. And today I will share about my PhD projects about ex vivo model in a human placenta. So I use this experimental model to study drug metabolism enzyme, especially in the human placenta, to know how this model can better understand about the placental toxicity and the fetal drug exposure. Okay, please next slide. So to start with a bit background, why I choose this topic is because we know that the placenta play a critical or a central role to ensuring the fetal health. So it doesn't just act as a protective barrier, but it actively metabolize drugs and express the drugs transporter, and also play a major role in determining how much the medication can actually reach to the fetus. For many drugs, we often don't know whether these drugs are toxic to the placenta or whether they can cross to the fetal circulation, and which enzyme or drug transporter are responsible to that. So my main aims for my study is first to explore or to understand the localization and the function and the expression of drug metabolizing enzyme in the human placenta. And the second is to explore the risk of the placental toxicity. And the last is just to studying the placental drug transporter and potentially to the fetal exposure. Why I choose the ex vivo model experimental is because in the recent studies, most of the available data or evidence come from the in vitro or the animal studies that we know, which often don't fully represent the human physiology. So that's why I will focus on the human-based ex vivo model that can maintain the structural and the complexity of the placental tissues. So in this study, I will use two ex vivo model, and there are first is the precision cut placental slices, and the second one is the placental perfusion model. Can you proceed to the next slide? Yeah, and this is how the procedure I will work with the placental slices and the perfusion model. So for the placental slices, I will work using the placental for within 24 hours after the delivery, and I will cut into the 1 or 2 large lobule. I have to choose the healthy placenta with no calcification, but we actually know that it's hard to find the placenta with no calcification at all, so we have to choose the minimal calcification in the cotyledon to make sure that we have the healthy placenta. And after that, we have to separate the fetal and the maternal part. And we have to take the decidual membrane and the thin layer for the maternal part. And for the fetal part, we have to cut into the cubicoid sizes. And after that, we can embed the tissue in the agarose. We're using the cylinder mold and using pin to hanging the placental tissue and put it the agarose. After the agarose is set, we use the slicer machine to do the slices. And we can see in here, in the picture, we have the fetal part slices, and the other one is for the maternal part slices. And after that, I will do the experiment to explore the toxicity parameters, such as the viability cells marker, and I do the LDH assay and measuring the ATP level also. And I will also look into the morphology of the slices. And for the placenta perfusion, I have to do the perfusion within 30 minutes after the delivery. So it's a different placental with the slices one. So I get the new and fresh placenta and have to do the cannulation within 30 minutes to make sure that the physiology of the human placenta doesn't disturb the condition. And first I will do the cannulation. I insert the cannule to the fetal vein and the fetal artery and pull the fetal and the maternal side and connected the cannule to the tube and insert with the drug solution. And we have to measure the red flow and also the measure to make sure that the vascular, it doesn't break and leakage outside the placenta. If this happens, we cannot use again for the placenta perfusion. And we can move to the next slide. So this is the whole project that I will do during the PhD. So in short, I will do the PCPS or the placental slices to get me the toxicity parameter, and I will do the placental perfusion to get me the placental transfer information. And once I have the data from both model, I will continue and look at the enzyme expression. I will look at which type of enzyme that expressed in the human placenta and how strongly they are expressed and how active they are. And last, I will also cross-check all these findings with the published clinical outcome from the pregnant woman. I will work with the TB anti-tuberculosis drugs, the second line, which is the beta-kilin, pretomanid, and linezolid combined with the moxifloxacin or with the clofazimine. And I will cross-check with the published clinical outcome to help validate the model and strengthen the clinical relevance of the result. By integrating these approaches, I hope that we provide the clear insight into drug safety during the pregnancy and contribute to the safer therapeutic decision for the pregnant women, especially who consume the anti-tuberculosis drugs. And yeah, that's all. Thank you. I return it to the Prof. Jarir as the moderator.
Thank you, Maya. Your presentation is very nice. I'm very overwhelming with this six already presentation. It's very good idea, right? It's a very full innovation and then very in touch for the very important topic and gap that's in our community. I think that's just what does Ph.D. about. You know, it's very nice to see the technology now. It's very going on in the pharmaceutical care. Okay, we have 10 minutes instead of 30 minutes of discussion. And please, if you have some idea, I think especially for our future students that they are still looking for the position, you know, two of them. And then also, I think Niken also give us a topic, you know, to be work together. And Rifqi, I think you know that we can work together all the time. And this is, I mean, if you have some comment, and please, yeah, Yolanda. Yeah.
Yeah, so I think very shortly in that sense, I think there is a very strong opportunity for you. When you presented your work on extracellular vesicles, nanomedicine, drug delivery systems. Now, yeah, there is a PI within the Department of Moniz, my colleague here, Inge Zuhorn. She is really a specialist in this area, so I would say that there is a very strong link, let's say, with the research that you propose and the research that she is doing within the department. So I already very briefly showed you the website page, so or ask Moniz because she can also give you the direct contact details. Yeah, so I think there is a very nice link between your suggestion. And then for you, you were the second student, right? Or, yeah, so presenting the health equality, basically. And I think also there we have a potential link within our medical center. Because our new Vice Dean of Research, who is coming from the economy, FEP from economy, but is also very much interested in health equality. So I think that would be a really nice link for you. Jochem Mierau is his name, and I can also exchange the contact details if you want later on. So that's for the prospective students. We already have two, I think, very nice links, but maybe there are more links that I haven't thought of, but these are at least the links that came to my mind.
Yeah.
I don't know whether I have questions for the other.
Sure, if you have
but
questions.
I don't know whether others would also like to have common suggestions for the other speakers. I don't want to make up all the time.
Please.
Yeah. Thank you. I would like to give a comment on the third presentation, I think, about the herbal use. Yeah, I think I could think of a very nice link, interdisciplinary project with social psychology, because with that you would like to understand why a human or a certain behavior, why they easily being influenced by others. So I think that would be a very nice project to collaborate between the social pharmacology and also social psychology.
Yeah, thanks. I have questions to several, but let's start with Rifqi. Daar ben je. Yeah. So I was interested in everything in your presentation. I remember clearly the graph that you showed of the relation between the pharmaceutical companies and what was your abbreviation? FETA. Very nice. I just wondered that now in Indonesia there's also the Health Technology Assessment Committee, the one chaired by another alumni of the Suwantika, Aulia. What is the role? There must be a role also for this committee in your conceptual model that you showed on the drug assessment. Just wondered where would you place it?
Yeah, so for the committee of HTA by Prof. Aulia, they make a prioritize what's the topic to be evaluated. So basically, this year, I think, the HTA committee, they have 10 topics about a new drug to be evaluated from cost effectiveness analysis. And then they give these 10 topics to Ministry of Health, and after that the Ministry of Health will find HTA agent. So basically our FETA is one of HTA agent.
Yeah. Oh, that sounds like a very nice position. Yeah. Before I give away the microphone, one more question if allowed. I think it was Arif was online. Was it Arif?
Yeah. Arif, yeah.
Yeah, and this is on the chikungunya vaccine.
Yep.
And Jarir also, I think it was suspended recently in the US because of some issues with the vaccine. And I just wondered whether the new administration form would actually overcome the problem that was noted by FDA. Did you follow that, Arif? That there was an issue? I think a safety issue.
Actually, I just hear about this issue about that there is like a concern about it. So far, I think there is one approved vaccine from chikungunya. It's called EX6, but I think it's still, yeah, I don't really follow that vaccine candidate because it's mine is completely different different type of vaccine. But well, what I would say that that well inactivated vaccine, in my opinion, it's way more easy to produce and also easy to manufacture in third world countries in Indonesia. In Indonesia, we have D.Pharm, one of the largest vaccine producer that, they also interest in well inactivated vaccine because it's more immunogenic. But I'm not quite sure about what is the issue with the IX-6, but yeah, I will say that FDA now is more strict to regulation and everything. But yeah, let's see what I can do in the future with this well inactivated vaccine. But sorry, Prof. Martin, I cannot answer your question clearly.
I'm very happy with your answer. I think you answered it. You have a very different type of vaccine. I think that is the answer.
Yeah. Yeah, so the chikungunya vaccine is still not marketed in Indonesia. Dengue, yes, because I think Indonesia dengue is a more high burden than the chikungunya, and we still need to do surveillance for chikungunya, whether this is really low burden in Indonesia. We don't know. So about the STA, I think We have a two panel now, Prof. Martin. This is a drug STA and then also medical devices STA. So medical devices STA is new. I think this is also quite important, and maybe we can collaborate it to have us make a guideline how to standardize the STA in the medical devices and procedures. And then, yeah, I think Rifqi is one of the agency now for the STA, National Committee for Conduct a Study Review on the drug. I don't know, do you have experience in medical devices so far? Not yet, right? Yeah. And then actually also we have Putri here. Putri is also one of the agency in the past, right, with the Kiki, also for the drugs, because we have two agency in UGM now. It's a working group for pharmacy and also working group with from the health policy. Yeah. And for vaccine, we have a different HCA. It's from NITEC. And Putri is also part of the health economic working groups for STA.
I help Prof. Jarir.
No, you help me. You don't. Yeah. So we have a lot of HTA in national. Okay. Do you have other question? Maybe one, two. Yeah.
For all of the presentation, I'm also very happy to see also one PhD candidate from Khalip really did the presentation online. That's really surprised me. And also, I think I'm very interested in the second presentation for the painkiller like management. I think from our pharmacy institute, I think there is also a group led by Professor Ilko Hack. He is really like do something related to pharmacotherapy and economics. And that group now is becoming bigger and bigger. I think maybe you can also check that website and also could find maybe some mutual interest with that group. Yeah.
Yeah, then also I think the third one, Niken also, because talk about pharmacoepidemiology of the herbal medicine, I think also can be related with the Professor Elko Haq, right? Yeah. Okay. Okay, I think because of time, so now time is 2:30, so we have a small break, 15 minutes. So you can have coffee and then tea, and then please come back again. So we're going to move for the second faculty, is Faculty of Medicine, and then we have a quite list of the presentation, yeah, because including the current student, future student, and alumni, and then also some researchers that want to collaborate it with the Groningen University. Okay, have a good break.
Ya, silakan Bapak Ibu untuk bisa mengambil coffee, tea, dan juga snack. Boleh dibawa ke dalam untuk dapat dinikmati dan juga kembali ke ruangan segera agar dilanjutkan segera pula untuk conference selanjutnya. Terima kasih.
I can't seem to fall. I'll see you in a
Some people need diamonds, some people need fame, some people need holidays, but I need you, I need love. I need love. Some people need fashion, some people need their space, some people need big mansions, but I need you, I need love. I need love.
En ook bij de Nederlandse taal, het is anders dan het is in de Nederlands. Het is anders en hij was bang als hij fout maakte met de
If it takes too long to hit me back, I can promise you how I'll react. But all I can say is at least I'll wait for you. Lately I've been on a roller coaster, trying to get a hold of my emotions. But all that I know is I need you close, and I'm just giving a shot for what I love. And down the line, sorry that I think I'm not enough. I'm sorry if I say sorry way too much. You can go ahead and call me selfish, but after all this damage I can help it. What you can trust, 'cause I need your touch. Now let's give it a shot for what I love. I should never get no fun. Too hard. you feel it's growing day by day? People getting ready for the news. Some are happy, some say we got the music playing late. What the people mean, it is the way to make them smile. Ain't so hard to do if you know how. Gotta get a message, get on pro. Oh, now mama, don't you ask me why. Oh, listen to the music. Oh, listen to the music. Oh, listen to the music. All the time. Where I know ever send me, meet me in the country. For a day we'll be happy and dance. We're gonna dance the blues away. Oh, I think I don't you best be well. Like a racing fun and breathing, soaring such a wide, all into the fore. Something even more, but that it makes a sound. Like a racing fun.
Within the UMCG. Yeah.
Voice being clear. No names.
No.
Okay. You can bring your coffee and tea and snack to inside, and we like to continue for the next presentation from the Faculty of Medicine, Public Health Nursing. I think the first we're going to separate because it's the presentator lists are quite a lot, and we are going to first session. We're going to asking for presentation from the current student. Both of them will be online. Dr. Rani, and then the second is Dr. Angriani, public health. Yeah, so one is from Department Cardiology, and then the other is from Department Biostatistics, Epidemiology, Health and Population. And then also there are two researchers. I think one, Dr. Yuda, orthopedics, and he's now in Jakarta. I think that's gonna be online. And then the second is Dr. Arko, that's from Department of Pharmacology. Also will be about the herbal formulation. Dr. Rani and Angriani, are you already online? Could you hear me?
Yeah.
Okay. Okay, thank you very much for your early morning presentation. I know that now is almost 8:45, right? Yeah, almost 9 o'clock. So thank you. I give you the time. Presentation will be around 5 minutes, and you going to talk about what the study you are currently doing in the Groningen. Please give it time first to Dr. Rani.
Okay, I would like to share my screen. Oh, it says that the sharing is not turned on. Oh, okay. Can you see my screen now? Should I just start?
Could you, can we do presentation from here? Mas? Yeah, Dr. Rani, we will share your presentation from here. Is it okay?
Yeah.
Okay. Okay. The next slide.
Oh, yeah, all right. Yeah, I have an updated, but okay, should work. Okay, ooh. I have some animations, so. Yeah, good afternoon, everybody. Thank you for having me. My name is Rani. In this presentation, I would like to tell a little bit of my PhD project right now. I will also give a little bit of a background on what we are doing currently here at UMCG Cardiology and yeah, basically the collaborations that we are aiming for. Can we go back? Yeah, I was not planning to present everything all at once, so that's why yeah. I would prefer to share my own screen. Okay, this is going very too fast.
Sorry, do you want to share your own presentation, Rani?
Yeah.
Okay, okay.
Please.
Yeah. Okay, we stop it now. Please share your presentation.
Yeah. Can you see it, Prof. Jarir?
No, we don't see it yet.
Oh. It says here that I'm screen sharing, so I'm not sure why it's not.
Okay, you can share your presentation.
Yeah.
Have you shared?
Yeah.
Iya, katanya sudah. Belum terlihat di situ.
Yeah, we had a practice run yesterday and it went well. So this was. Let me try it again. Okay. Can you see it?
Not yet.
No? Oh. Okay, well, I think we can just use the presentation from UGM, it's fine. I will.
Tutup itu yang kanan.
Okay.
Yeah, I think you. Ya mas, sudah? Sudah nggak mas?
No, it's fine. I think we can just use the slide from UGM. Should be fine. Can you start the slide? Yeah.
Okay.
Okay. So I started my research journey in 2019, I believe. I was a research assistant and project manager for POC Genetic Genetics Working Group under the supervision of Professor Gunadi. And Afterwards, in 2022, I got admitted at UMCG Cardiology Research Institute here in Groningen under supervision of Dan Westenbrink, Michiel Erasmus, and Kevin Daman. Dan, I believe you're there. And my project is about improving heart transplantation through pharmacological therapies. So a little bit of a background of what I'm doing is that essentially, because heart transplantation is the life-saving therapy in patients with advanced heart failure, but right now there's a problem of a mismatch in donor, that there are a lot of people who need this donor hearts, and there are not enough donors available. So in my project, we have two proxies or two proposed solutions for tackling this problem of lack of heart donors. The first one is left ventricular assist device, or LVAD, which provides a temporary relief or a bridge between patients who need the heart transplantation and before they are getting the heart transplantation. And there's another method of donation, which is donation after circulatory death, or DCD heart transplantation, which provide the possibility to enlarge the donor pool in this in the setting. So our aims are first to understand the effects of LVAD in heart transplantation recipients. Second, we would like to identify the molecular changes in DCD heart transplantation, and we want to know how to improve the heart viability by means of pharmacological and metabolic therapies. Next slide, please. So the first project, or the LVAD project, I was able to work with one of the first Netherlands data of LVAD patients who had undergone heart transplantation. And this goes way, way back to 2007. So we compared patients who received the LVAD treatment and those who were medically managed only. And then afterwards, all of them receive new hearts, or they are recipients of heart transplantation. And we evaluated for mortality, for graft or heart rejection, and kidney complications. And there we saw that there's no significant difference between those two, even though that the LVAD was implanted in the patients for quite a long time, more or less 2 years. Next slide. And I was also able to, so the big part of my project is actually the DCD heart transplantation project. And I was able to participate in establishing the Groningenship model for heart transplantation experimental research for the DCD. This is a special model because essentially the patient, well, in patients, they need to first be declared dead before the hearts or any organs can be procured. So this is a very short time limiting type of project. And I was also able to develop the ex vivo pressure volume loops analysis platform. So this is one of the ways that we could in real time evaluate the quality of the donor grafts. Slides. And recently I was participating in research internship in Aarhus University Hospital in Denmark for 2 months. And I was the lead for normothermic machine perfusion and porcine or in pigs DCD heart transplantation research, which was a big part of what they were doing in Denmark. So we had a lot of knowledge transfer, and I was able to lead our normothermic machine team, and yeah, we had really fruitful collaboration. Apart from that, I was also involved in DCD heart transplantation project utilizing human hearts rejected for transplantation. So as you can see that this is a very translational approach from large animal models up to humans. And other than that, I was also a supervisor for master students. I gave workshops in heart perfusion. So there had been a lot of opportunities where I could expand from my comfort zone. Slide. And yeah, there are collaborations that are now being held between UMCG Cardiology and University of Gajah Mada University. Is that yesterday Dan had given a guest lecture at Department of Cardiology, and then in the upcoming 1.5 week, Yuri Blau, which is one of also our attending at UMCG Cardiology, will also give another guest lecture on atrial fibrillation. Yeah, I think this is the end of my presentation. Thank you for having me.
Yeah, thank you, Rani. Applause. Very nice presentation and good luck for your study. And I know that you just back from Denmark. I hope that you have a lot of experience in Denmark for study on cardiology. The second, Angriani, are you there?
Yes.
Yeah.
Dr. Jarir?
Yeah, Dia, can you, Rani, can you stay a bit longer because after the 4 presentation we're going to have some discussion.
Yes, yes, of course, I'm here.
Okay. Yeah, Angriani, it's your time.
Okay. Thank you, Prof. Jarir, from the opportunity. Good afternoon, everyone. I am Aang, second-year PhD researcher at Campus Friesland, University of Groningen. So greetings from Friesland provinces, the northern part of the Netherlands. So I would like to present my current PhD project. Could UGM please help me to present my slide? Yeah. Okay, so my PhD project is about investigating the pathway to impact of school-based comprehensive sexuality education using gender transformative approach in improving early adolescents' health and well-being. So back between 2018 and 2022, UGM joined with other 11 countries across 4 continents into a global initiative named or well known as a Global Early Adolescent Study led by Johns Hopkins University to explore how comprehensive sexuality education in and or out school based using gender transformative approach can improve early adolescents' health and well-being. This initiative aims to answer the gap, especially in evidence-based for this intervention, because early adolescents have proven as the one of critical periods in developmental phase, especially after puberty emerge, because there is a significant and intersectional change of physical, emotional, sexual, and social. And evidence also suggests that gender norms begins to intensify during early adolescence through interaction with various socialization agents such as parents, peers, educators, and the media. But unfortunately, in the past few decades, our evidence base only focus among older generation between 15 and 24, and we have less focus on this early stage of adolescence. So that's why this initiative, the Global Early Adolescent Study, aim to answer these gaps. In Indonesia, on those periods, we investigate how this intervention affects early adolescents in Asian settings, especially Indonesia, in 3 provinces, in Bali, Jawa Tengah, and Lampung. And from those findings, we use mixed methods to evaluate quasi-experimental study at a school implementing this program. And we found that the effect of this intervention is really contextualized. The outcomes that emerge among early adolescents is quite different between girls and boys. So that's why my PhD project aimed to follow up this finding by trying to figure out why this intervention affects differently in different contexts. What is the specific characteristic of the intervention, the facilitator that they influence the successful or the outcome. So in this project, we try to use realist lens. Realist lens aim to focus to not only observe the outcome, but also understand the strategy, the response it triggers, the outcome, and also the key success or the context. We hope by knowing this configuration, we will increase the chance for other countries or setting to adopt similar intervention and contextualize to their own setting. So it means that we target more scaling up for this similar intervention. This approach is important because comprehensive sexuality education using gender transformative approach is a complex social health intervention which influenced not only by the characteristic of the students, but also profound values that hold by the facilitator, the teacher, and also the school environment like headmaster and also stakeholders that influence education system. So hopefully by understanding how, why, and in what condition this intervention works across different actors and developmental stage, we can improve the scale up effort for this initiative. For the activities, this project consists of systematic literature review to map how similar intervention across different settings around the world in the past 20 years, resulting effect, what things that works, what doesn't, and what settings that influence these outcomes. And after that, we use the result to conduct empirical study by evaluating CSC intervention in Indonesia in 7 districts. The data collection just finished early this year, and it was funded by Yayasan Gemilang Sehat Indonesia. Also, mid of this year, we got funding from UNFPA Indonesia to collect empirical research around pilot CSE scale up conducted by Ministry of Education and Ministry of Health, Indonesian Ministry of Education and Indonesian Ministry of Health, because Indonesian government commit to integrate comprehensive sexuality education into our national curriculum. So we help the government to navigate how this integration works, and hopefully learning from this pilot evaluation will help the government to improve or to find the model that suits best to our formal education system, and more early adolescents will receive in this intervention or comprehensive sexual education in formal education. So the Ph.D. project itself also got funding from LPDP, and the research collaboration consists of Dr. Berfu Unal, Dr. Valentina Galuh, and Dr. Pelin Gul from Campus Friesland, and we also collaborate with our partner from Rutgers, Netherlands, Dr. Miranda van Rewich, and also from Karolinska Institute, Anna Kagesten, who also joined in Global Early Adolescence Health Initiative. So that's a brief information about my PhD project. I give the time back to Dr. Jarir.
Yeah, thank you. Applause for Anggriani. Thank you. Your study very relevant for Indonesian adolescent education. Yeah, we're going to discuss it because this is very important topic, and also your study have a very broad collaboration with other institution as well. So hopefully that we also can learn from you. The next is from Dr. Yuda Matan Sakti online.
Yes, Prof. Jarir.
Yeah, you are there. Okay, thank you. Are you in Jakarta now?
Yes, apologize, Prof. Jarir. It's a really
Yes.
great honor to be able to join and then
Okay.
hopefully can share. Yes,
Okay,
share.
this your give your time. Yeah, you can give presentation.
Okay. Thank you very much, Prof. Jarir. And again, for everyone, it's a great honor to be able to finally meet up with Groningen, at least online. So, if Universitas Gadjah Mada, can you help me to share the screen, please? Um, yeah. So this is the thing that I'd like to share. That's I think we hear about Rani and Aang heard the marvelous experience in Groningen. This is the thing that I finally take back to Yogyakarta, especially in Indonesia, since what I'm going to present here is already being applied throughout the orthopedic education or residency program, in which one of the things that I see is the different way of teaching and environment in creating a well-being support for residency. So regarding the current problems, we go from the left side of the presentation, in which I think we can all appreciate that there are stress factors while becoming a resident, especially those who hold knives, especially in orthopedics, in which the stress is actually identifiable to previous studies in which they are related with the patient's outcome, maybe less of the ability to express themselves, inability to have a lot of pressures in studying and learning surgeries. Therefore, as an educational program, as a good educational program, well-being is something that is need to be addressed in a way systematic and comprehensively support the conditioning of learning activities. Therefore, while learning in Groningen, I pick up some of the things that we applied as a strategies, and that strategies include these three rounded things on the right hand part of the PowerPoint. That is in which this kind of a meeting increased awareness that well-being is something that needs to be underlined, highlighted in especially in residency educational program. That's what we all currently doing and keep evolving, involving a lot of different Indonesian programs, such as the coffee talk we make about how residents should think about their well-being, how the programs should also consider well-being as one of their programs or to be embedded in their educational residency program. The other circle, the next circle is to actualize a support system. This is also something that's quite new in Indonesia, in which we involve the parents like a PTA meeting for residency inner circle that also correlate with their family and their spouses to be involved, to be engaged on the education system. So we take them to our system and in a way let them know what's happening to the residency program. So in a way, the residents have a better inner support if in some time they have different or increased stresses during their education. So that goes to the second circle. And the last circle is to improve pressure canalization. This is something that's also needed so that residents become more of a family towards their staff, faculties, and also their learning educational system in the hospital and in the university. So we imply that by having a lot of different societies or activities within our societies to involve them as one big family. Next slide. Next slide, please. UGM. Okay. So how do we implement that? So we implement that by evaluating them, embedding them in the program of electronic logbook. We call it well-being support in electronic logbook. As we all know, a logbook is something that is needed to give a portfolio of what the activities of the residents. However, not just that, we are pushing more by embedding the well-being evaluation within the e-logbook. Internationally, also, I think in the Netherlands, they have the physical well-being index, PWBI well-being index, in which regularly we check the condition of the well-being of the residents or students that we applied on our well-being monitoring system. So we create, like in here in Indonesia, we have a Gojek, in which every month we ask the residents to personally evaluate their well-being condition, whether it will be 1 star until 5 star. In this, if the resident in any way have a condition of 3, 2, or 1 star, we have a direct flagging system to the head of the program, secretary of the program, and also admin, in which we collaborate this with Prof. Yai system of the professional evaluation for medical students to give them a well-being support psychologically. So this is the thing that we call a well-being monitoring system that's embedded in our electronic logbook. That concludes my presentation, Prof. Jarir, in which while studying there, I'm not only developing, I'm doing a biomaterial research, but I also picked some of the things that also needed to make our education better, especially in Indonesia, more over highlighted in the physicians' well-being, especially in the residency during their process of learning. Thank you very much, Prof. Jarir, for the opportunity.
Thank you. Applause for the Dr. Yuda. Thank you. I think that you're going to present about my biomaterials of the orthopedic, but you touch a very different way about the education and residency on the orthopedic residency. Is surprising, and then you are become medical education now. So thank you. I think the issue of the well-being of residency is become very big issue now in Indonesia, isn't it? Yeah, and yeah, I think this also will be from colleague from dentistry, which also maybe important because you also have residency for specialization. And then we have a colleague from medical education here, Dr. Yuda, and also colleague from Groningen from social science. And then I don't know whether there's a colleague from medical education from Groningen University also online now, because I invite them as well to hear your presentation. Okay, thank you. We go for this session. The last is from Dr. Arko. Please, this is your time. Yeah. So we can have a discussion later, yeah? You can stay longer, Dr. Yuda? Yeah.
Yes, Prof. Jarir, I'm here.
Okay, thank you.
Check. Okay, thank you very much, Prof. Jarir, and welcome to Yogyakarta, ladies and gentlemen. So today I would like to present about the herbal medicine in Indonesia, especially facing from the global warming. Global warming. Yeah. So what I want to tell you here, actually, we have this kind of map. This map is about the Indonesian, this is Indonesian. So I just want you to imagine how large Indonesian is. So you can imagine if you travel from UK to Ukraine, then it is Indonesia. So it's very huge country. If you take apart from here, Aceh to Papua, then you take more than 6 hours by flight. Yeah, this is Indonesian. Then I want also to mention that why Netherlands people like to stay here for more than 300 years, because we produce a lot of we produce a lot of spices which is very valuable in Europe. I live in Europe for almost 5 years, so I know very well how valuable spices in Europe. What I want to tell you here, this is the map. Actually, this is not my map, but I have direct access to this map. So we have this kind of Indonesian map about the formula of ethnic ethnomedicine from its area, from Aceh to Papua. 6 hours by flight. So from this map, we also have about the not only the formula of the ethnomedicine, we also have about they also mention about the indication with the local use for disease or illness, and they involve more than 32,000 formula from more than 380 ethnic, and it contains more than they identify what kind of formula for what kind of disease, which more than 235 indication. What does it mean? It means that we have a huge big data here, how local people of Indonesia, they adaptation with the disease by using their herbal medicine from its area. So you can imagine, it is nonsense for the local people from Papua to copy paste the formula from Aceh, right? Because it's 6 hours by flight difference. So it's very far away. So we then from all this big data, we analyze, oh, this is very interesting, because from the Koch formula, for Koch indication, we take a look to all the formula from Aceh to Papua, then we found that curcuma lunga almost used in every part of area in Indonesia for Koch indication. Not only curcuma lunga, but also Citrus aurantifolia in many, but not all, and also Alim saifa or Alim like the red onion, and also pepper betel. So from this species we map, we also identify what kind of metabolite, secondary metabolite, which is correlated one to another, and for this kind of indication, Koch. Is it logic from scientific or not? So this one, I just want to show you this data, and we found that there are many kind of compounds, but we want to highlight like monoterpen, limonen, alpapinen, pitapinen, sesquiterpens, and also penylpropanol or phenolic eugenol. It is really relevant to the Koch indication, and this is how local people in Indonesia adaptation with their disease by using their resources. I mean the local resources. Of course, this is nonsense for us, yeah. So what? But then it will be big sense for this one. So you know, CPI is one of the center for promotion of import in EU. Yeah, I know it. So from many developing countries, if they want to sell their, let's say, spices or their herbal medicine or any kind of plants, go to Europe. Usually, this agency is the entrance. Yeah. So the problem is CPI they have their own task to secure the stable supply of herbal raw materials to EU, to European, especially with special indication. And I know also I check it in detail that in Netherlands, the Dutch people import very huge amount of nutmeg, cloves, cinnamon, pepper, and ginger from Indonesia. So this is good, yeah, because Indonesia is one of the top global player for the exporter of this kind of herbal materials. The problem is we already know about this one. We also already know about what I told you already, but we don't know. Even for Indonesian, we don't know about the active compounds. The standardization of the herbal in Indonesia is very low. I mean, we don't have system how to make the compounds very, let's say, if we want to make species, let's say, cloves with the high level, grade A, or the second level, grade B or grade C, we don't have this kind of system. Because we never able to map about the quality from Aceh to Papua, which one area is the best to produce cloves, which one to produce curcuma lunga, which area is the best to produce the Alim sativa, and something like that. So this is opportunity to us to grow RUG and UGM. If we want to make this kind of big data, then we can sell this information not only for us, but also for the industry. If they need the high level of herbal species with the grade A, then it can be supplement. But from the lower level, it can be spices for food. Or from the lowest level, it can be only for the filler. Then this data is very economically beneficial for all of us. So what can we do between UGM and Groninger here? Actually, we can provide with this kind of analysis with the data. But we have no ability to make analysis because we don't have multi-top here, we don't have LCMS here, and it's really difficult for us to make this kind of data bank analysis in Indonesia. And for you, I think, I don't know, but I checked your website and you have equipped with all of this technology. So we can send the dry lab data. You can, if you want to make collaboration, then we can make the wet lab in RUG, and also we can involve CPI as the exporter and importer of this kind of materials, because they will sell this information, let's say to Ricola company in Switzerland, or maybe to fishermen friends in UK, or maybe also to Napoleon drop licorice. Yeah, this is many companies I know, you already know about this one, because they are in Netherlands. So this kind of data is really beneficial if we want to make really collaboration about herbal medicine in Indonesia. Thank you very much.
Yeah, thank you, Dr. Arko. And Dr. Arko is graduated from the Innsbruck University from Austria, but he willing to collaborate it and also have a going to supervise, if any, of the herbal medicine, especially in the ethnopharmacology. Yeah, thank you very much. So, could you stay? We can get discussion now. Do you have some question or remarks, please? We have already 4 presentation about Dr. Rani on improving heart transplantation through the pharmacological therapy. Angriani, it's about the gender transformation approach, yeah, on the sexually education in Indonesia and in adolescent, and Dr. Yuda about well-being of the residents, and Dr. Arko is about the big data analysis for indigenous herbal medicine. Yeah, okay.
Thank you. I would like to give a comment for the presentation for Ibu Anggraini. Yeah, it's about the school-based intervention program, and in the topic of sex education, I think, to prepare the children entering the youth phase. I think this is very important, and I think for Indonesian people, this topic is a bit taboo. I think parents will not talk openly with their kids about this. So I think it's very important, and I'm wondering about the 7 districts that will be conducted for this intervention, because it might be different from the metropolitan city or in the rural area. And should I go on with the second comments for another presenter, Prof? Yeah, so the presenter by Yuda, I think I heard a lot about the well-being of the residency doctors. I think this is also another important topic in our context. I think I would like to know about the implementation later, when this e-logbook already successfully piloted, and then it showed that it has a significant effect on the well-being, for example. And how would you like this intervention implemented in the future? Is it will be in all hospitals, or is it for the first, second, the whole day, 7 weeks, or yeah? Thank you.
Yeah. So this very important question, and Angriani.
Yeah, thank you, Ibu Novika, for the question. So, since our previous project with under Global Early Adolescent Study have evaluated the effect of this intervention, this kind of intervention in Semarang, Bali, and Bandar Lampung, which is more like urban area. So that's why in my PhD project we focus on more rural area like agriculture with specific challenges for early adolescents, for example, like early marriage, and also in the area where like bullying and gender-based violence are quite violent. 7 districts that we involved under this PhD project is Langkat, and also we have Jawa Barat in Garut and Indramayu, and also in Jawa Timur we have Jombang and Jember, which is characterized by strong belief on traditional gender norms around in dominated Muslim settings or pesantren area. And the last one is Nusa Tenggara Barat in Lombok Timur and Lombok Barat. We aim also like dominated by Islamic setting with traditional strong gender belief. Hopefully this more rural area setting will help to also enrich evidence-based around intervention, evidence-based around intervention, this kind of intervention, because most evidence-based came from research in the past few decades, present knowledge for urban settings, but not from rural with specific challenges for early adolescents. So hopefully evidence we gather from this project will fill that gaps and contribute to more equality for comprehensive sexuality education access for early adolescents, not only in urban but also rural settings. And the finding will also help Indonesian governments to find the fits models for integrating CSE in our formal education systems, not only in urban, but also how to make stigma, taboos, and increase acceptance, especially among parents, if their kids receive this information at school. So that's the aim why in 7 districts that we involve in this second stage, mostly in rural setting.
Thank you. So your population will be more to rural setting. Yeah. Yuda?
Yeah, thank you, Prof. Jarir. So thank you very much, Bu Nautica, for the question. So the thing is about the implementation is actually it's already being implemented, not just in orthopedic, but it's also implemented in 6 different residency programs. There is the heart, and then neurology, and radiology oncology, and then eye, and also OBGYN, and the other one is pediatric. So it's not only in orthopedics. The thing is, we would like to create early awareness system in which we have a flagging system whenever they work more than 80 hours per week. That is the bare maximum standard of national activity, international activities within inside the hospital for a residence. So we are creating an early warning system for the program, so that if a resident works more than 80 hours, there will be a flagging system. That's one. The second thing is, whenever they reach or feel any discomfort that's related or translated with star 3, star 2, or star 1, it creates a flagging system to the program director and all the main stakeholders that take care of the education system, to be able to support them in a way much faster. So has it been good? In a way, it's been done roughly now for 1.5 years, 1 year plus. It's been good, but however, there's challenges because Indonesian people tend not to be as open as our fellows or our colleagues in the West. So there's the challenge. However, we are trying to create a system. That's why not just taking the knowledge on biomaterial, but we take this as one of our take-home message while we are studying, especially in the Netherlands.
Yeah.
I hope that answers the question, Prof. Jarir.
Yeah, thank you. I just want to ask colleague from the Netherlands, from Groningen. So these 2 research is done by the UDA and also ARCO about ethnopharmacology. To which group in the Groningen that we can collaborate with?
You mean with the medical education?
Whether this is a typical medical education intervention that can create for the ethnopharmacology, is there any group that we can collaborate with? Yeah.
So I think the ethnopharmacology would be good to collaborate with the Department of Clinical Pharmacology. It's pretty broad. I think that there's a department for that.
Yeah, and you know, Professor Sp.An is a clinical pharmacologist, yeah? So your collaborators in front of you.
So I
yeah.
think for the, whether this honor, but for the medical education, I think Jaap Tuleke, who is involved in the Central Committee for residency programs for the educational, would be, I think, a nice link. Because we have implemented a comparable system in the Netherlands as well in the residence program, but Dan probably knows much more about that than I do. But I think Jaap Tuleke, right? Is that the right link? Yeah.
I think just first of all, I think it's very important to recognize mental health in medicine, and particularly in the caregivers that are going about. And if you're talking about 80-hour weeks, that's bound to be a major burden on mental health. So I think it's good that there's attention for that. And it's part of our regular training program as well. It's part of our educational program. And we try not to make 80-hour weeks.
Yeah, and I think your comment that in the West people tend to be more open than perhaps here in Indonesia, I'm not so sure about that, because also in the Netherlands, I mean, also in the Ph.D. program, of course, well-being is an important topic as well. And we very often realize that students sometimes start to talk after they have received their PhD, and because of the strong relationship, dependency on the relationship. And I think, and the same dynamic is actually ongoing in residency programs. So I think we also need to collectively work on an environment that people are indeed dare to speak up and come up for their well-being. It's a very important topic.
Yeah. Yeah, I heard that also. I think in the Netherlands they want to reduce as 5 days working into 4 days working, right? Yeah.
Well,
or still debating in the national level.
I have to say that the vast majority of PhD students have a 5-day working week.
Okay.
But I have to say that there are academics, but also medical specialists that do indeed work 4 days or 3 days, depending on their care at home.
I think that it's not an official 4-day work week, but there is the opportunity to do your training and your clinical routine part-time, and it's not that uncommon. I think about 50% is now doing it part-time.
Okay. Yeah. So Dr. Yuda and Dr. Arko, you know that you now linked with the collaborator from the Groningen. So please, we can keep in touch and then continue, and then probably we can have a more innovation for development in future by doing this collaboration. Thank you very much, and then applause for these 4 presentations. So, the next is we go to the future students and alumni. So this is gonna be 8 presentation, so it's quite long. So for Dr. Mia and Dr. Rifqi, that both of them are already have fine day supervisor, I think, and thanks for to the matchmaking. Yeah, so Dr. Mia, it's your time now, and after that, Rifqi.
Okay, thank you for the great opportunity, Prof. Jarir. Let me introduce myself. My name is Mia Munawarah Yunianti. Now I'm a lecturer in Department of Pharmacology and Therapy. And from 1st February 2026, I'll become a PhD candidate in Department of Genetics, Graduate School of Medical Sciences. And she's my main supervisor, Prof. Anke Hilse from Department of Genetics. And my co-supervisor is Prof. Lut Franke from the same department also. Next. Okay, and then for my PhD research proposal title is optimizing drug treatment by improving pharmacogenetic using a mega-scale biobank analysis. Okay, for the background, if we talk about the drug, I think we will talk about the drug efficacy and also the drug safety. And either drug safety and also the drug efficacy varies considerably from one patient to another. Many important factors that may be contributing to this outcome, such as the gender, and then health condition, and then ethnicity, and also concomitant medication. And the important factor that may be contribute also to this outcome is genetic factor. Genetic factor maybe will affect the drug pharmacokinetics in the body. And when we see in the clinical trial, usually we select the patient group carefully. We have a strict inclusion criteria, and also we have a strict exclusion criteria. So maybe the reported side effect may not fully represent in general practice. And then the previous studies investigating genetic factor related to side effect or efficacy, the majority of that had a low sample size and limited genetic data available. So maybe the result of this maybe we can difficult to conclude. But nowadays, especially in Europe, there are a lot of very large database, the cohort database that link to the electronic medical record. So it will give the opportunity for us to identify what gains that may be related to the side effect. So the research objective for my proposal study is to identify genetic factor influencing drug therapy problem in a very large scale database. For the study population, we will collect the European large cohort study from Lifelines, from UMCG, and then we will use also the UK Biobank, UBioPred, and also the FinGen. And we estimate the number of patients that we will analyze is above 28,000. And then for the study design, firstly, we will conduct a method validation, because all we know that in the electronic medical record, basically usually side effect or the non-response to drug is not directly stated in electronic medical record. So we will collect the data from the patient that have newly prescribed drug, and then we will validate with the simvastatin drug, and then we will select the patient that they experience discontinuation of the drug, or if they get the double dose or half a dose in a certain period, we will conclude that this patient is get the side effect. So after we conduct the method validation, after that we will do the selection of drug. We will choose 10 commonly drug prescribed in the Netherlands to do the GWAS or genome weight associated study in drug that are the drug without any pharmacogenetic known of related of the adverse effect. So maybe that's all from me. Assalamualaikum warahmatullahi wabarakatuh. Good afternoon.
Thank you, Dr. Mia. And you're going to start in February, right? Yes. Okay. The next it's Kiki, Rifqi. It's on the health economics. Yeah.
how to. Thank you very much for this opportunity. So good afternoon, distinguished professors and colleagues from University of Groningen, as well as esteemed faculty members from Faculty of Medicine, Public Health and Nursing, Faculty of Pharmacy, as well as Faculty of Dentistry at Universitas Gadjah Mada. It is an honor for me to have this opportunity to present my proposed doctoral research topic. My name is Rifqi Salatshita Khair Mahardia, or you can call me Kiki. My professional background is medical doctor, but I've grown increasingly fond of health economics and health technology assessment later on. And first of all, I would like to express my gratitude to Professor Martin Posma, who has kindly agreed to be my supervisor. Thank you so much. And I'm equally grateful to Professor Jarir for connecting me with Professor Martin Posma. Today, I would like to introduce my proposed research, which is titled Evaluating the Cost Effectiveness of Lung Cancer Screening Strategies in Indonesia, a model-based approach informed by expert elicitation. So this research topic is actually motivated by the urgent need to strengthen the cancer screening policies in Indonesia, particularly for lung cancer, which remains to be one of the country's most fatal and resource demanding diseases. So let's start with the rationale of the study. Okay. Sorry, how to operate this actually. Yeah. Okay, let's start with the rationale of the study. Lung cancer continues to be one of the leading causes of cancer deaths in Indonesia, particularly in male population, since Indonesia has the highest male smoking rates in the world. So by the time I developed this proposal, the figure is 70%. So 70% of male population in Indonesia, smokers. And the last time I checked, just a few hours ago, the figure already increased to 72%. So apparently, being healthy men in Indonesia is minority. Yeah, yeah. So given this issue, we also acknowledge that our national early detection screening policies in Indonesia remain inconsistent and we can say fragmented. In addition to that, Indonesia lacks high quality data to inform the screening policy. Also, evidence from high-income countries does not translate neatly into the Indonesian context due to differences in resources, cost, and health system capacity. So in this situation where national or high-quality data are limited, structured expert elicitation, or SCE in short, may provide an avenue to generate credible and context-specific parameter estimates. So the main objective of this study is to evaluate the cost-effectiveness of alternative lung cancer screening strategies, particularly the low-dose CT scan or LDCT and chest X-ray for high-risk populations in Indonesia. And to ensure the contextual relevance, this evaluation will also integrate or incorporate locally informed parameters which are derived through the structured expert elicitation. Currently there are various structured expert elicitation protocols such as shelf protocol, modified Delphi, etc. So moving on to the design and methods. This evaluation will use a model-based economic evaluation, which begins with systematic review and meta-analysis to synthesize global evidence, and followed by structured expert elicitation. And then for decision analytic modeling, either with Markov model or microsimulation model, we'll compare LDCT, chest X-ray, and potentially referral-based screening pathways. And then afterwards, incremental cost effectiveness ratios and budget impact analysis will be calculated to assess the affordability of potential policy options. So the findings of this study hopefully will provide the context-specific evidence to guide national lung cancer screening policy. And the results of this study hopefully will also support guideline harmonization and inform the more efficient resource allocation, as well as to strengthen the use of health technology assessment in data scarce settings. And beyond the immediate policy implications, this study will also provide a practical example of how expert elicitation can be integrated into economic modeling to support decision making in low and middle income countries. So to conclude that this research proposal is just a starting point. I truly hope that I have the opportunity to refine and develop the research under supervision with Professor Martin Posma, as well as experts from University of Groningen. And I also, my aspiration is that this study not also to advance evidence-based cancer screening policy in Indonesia, but also will grow into a joint academic effort with a meaningful impact. Dank u wel. Thank you very much for your attention.
Yeah, thank you, Kiki, for your presentation. Hope that you can also give this evidence later on to our policy making. So we have next gonna be our discussion, but we continue first with alumni. So we have Yoyo Suhoyo from Medical Education, Ajeng Fiska Ichanefilia from Radiology Department, and Diah Ayu Mira from Dermatology Department, and Paranita Veronica, is it here? Yeah, it's there, yes. It's from Anatomical Pathology, and also Antonia Morita from Department of Internal Medicine. So you know that we have already so many alumni from our Faculty of Medicine, and it's not yet the other because they're not coming. So now, your time.
Okay. Good afternoon, everyone. I'm Yoyo Soyo. You can call me Yoyo. Always happy and excited when meeting people that's related with Groningen, because no matter happen, PhD time is one of the most beautiful time in my life. Please let the people in Groningen know about that. Okay. I'm going to present regarding one of our dreams, developing simulation center for better clinical education. Next slide. So let me tell a little bit about the story, our current development regarding the simulation center. Oh, okay, sorry. Oh no, too fast. Okay, so our development started 2020 when at the time is a pandemic, COVID pandemic time. At the time, based on our assessment on student, the student really have a problem with the clinical skill during clerkship. So that time then we developed the simulation, and I think that the first time we developed a simulation center for our clerkship student. So, but that's only for medical students as part of pandemic effect. And then 2021, we continue the simulation program. In the beginning and also at the end of the clerkship is a part of to develop and improving clinical skills of student before and after clerkship. So we really want to know the improvement of student, but of course at the time we still have in the pandemic COVID-19 pandemic time. So it is related with that period. But then based on our experience, then we develop new simulation related with the interprofessional education. So in 2022, we start developing simulation for interprofessional education that involve medical students, nursing student, and dietitian student, especially for them who will start the clerkship program. So it's at the beginning of the clerkship program. And then it's continue until now, and this is what is a part of our we're really proud with this program because it's one of the special program in our medical school, when we can combine three medical school, nursing school, and dietitian school together in one program for in the clinical level or in the clerkship program. And then this year we add the simulation program. We integrate the simulation program into clerkship program. So that's what I learned when I was in Groningen, that every beginning of the clerkship we start with the simulation. So it's something like prepare clerkship student before they directly involve interaction with the patient. We introduce them with the simulation program. That's during clerkship. So the first four development is more focused on medical student and also nursing and dietitian student. So it's just for undergraduate. But this year, because one of the milestone of our current deanery is to develop simulation center, not only for undergraduate but also for residency program. For this year, we developed residency program. The building will be at 6th floor at the south building, but I think should be this year, but I think will be started next month or next year. But we really hope that next year we can start the simulation program for the residency program start next year. Yeah, for preparation, for also assessment, and also for continuing medical education. That's the current development of our simulation center. For the future development, we really know that UMCG already have simulation center at the UMCG. So we really hope from our meeting today, we can really develop the collaboration, especially to develop the our current our simulation center. That's our plan for the simulation centers, and at the 6th floor of the south building. But actually, we plan in the future, we really have a new building that's special for simulation center for undergraduate, for also for residency program. But of course, we know based on we did some benchmarking. It's not easy to build the simulation centers. So we really hope that we can make the collaboration with the UMCG, with the Groningen University, how to develop the curriculum, how to implement curriculum, but also how to assess the simulation. And we really hope also in the future we will have the maybe PhD student that will explore or study more about the simulation center. That's all for me. Thank you.
Thank you. Yeah, thank you for your innovation for our education, Dr. Yoyo. I think simulation center will be very important for our undergraduate and postgraduate students. Yeah, so we're going to discuss it later about link to the UMCG simulation center. So next is Icha.
Good afternoon, everyone. I would like to express my greatest gratitude to the committee for today's opportunity for me to present our past and also ongoing project, and also hopefully for the future collaboration. So first of all, my name is Ajeng Fiska Ichana Filia. Please call me Icha. I used to be a student, a PhD student of Professor Martin Posma and Prof. Jarir at Thobari, and also Associate Professor Thea van Asselt. So I'm from Department of Radiology. However, I have a huge interest in public health issue. That's why my PhD thesis is about health technology assessment of mammography for breast cancer screening in Indonesia. So since mammography is the gold standard for breast cancer screening, but it has not been subsidized by the Indonesia government as a breast cancer screening program. That's why I had an idea to explore about the possibility of implementing this new technology in Indonesia and subsidized by the government. So the health technology assessment itself, it contains various perspectives from the social perspective. So we were looking at the knowledge and acceptance of the community about this mammography screening. And we also explore about the barriers in the health system. How is the current early detection program implemented in Indonesia? And then we also look at the clinical effectiveness of mammography, because maybe you already knew that this is a gold standard, but it's mainly for the Western population. But for the Asian population, mammography has less accuracy in terms due to the genetic differences in the breast density and etc. And also we will exploring about the cost effectiveness. And finally, our thesis concluded that mammography screening is a well accepted, well recognized, and also a cost-effective screening strategy, especially if it's implemented among women aged 40 until 59 years old, and it's conducted every 2 years or 3 years or 4 years with the participation rate 70%. So that's how we concluded, and also, but we also noted some barriers during during our study. So from that thesis, we still continue our collaboration. So I would like to also announce that next week we will invite Thea van Asselt coming to Jogja to give a visiting professor guest lecture and also workshop on health technology assessment. The workshop will be attended not only by the UGM community, but also it's going to be participated by people from the Ministry of Health, from the BPJS, the National Insurance Company, and also from the commercial commercial industry, and also from the district hospital. So we have various participants for TEA next week. And also along with TEA, she will come with her husband, Dr. Yuri Blau, that actually has been mentioned by Rani before. Dr. Yuri Blau is a cardiologist from UGM-RUG, and he will give a talk on navigating atrial fibrillation and ablation in the Department of Cardiology. And I also supervise several bachelor students from RUG in 2023 and also this year, 2025. And for the future projects, really hope that I still have the opportunity to continue HTA project with the RUG stream. And also we have a plan to welcome another team of RUG bachelors in 2026. And also because right now I am still in my residency in radiology department, I'm looking forward to have a more collaboration in terms of clinical settings in radiology, especially in the field of breast and gynecology imaging. So I'm looking forward for any input from you if there is anyone that I can contact in the future. Thank you very much.
Yeah, thank you, Icha. So Icha already have a lot of collaboration. Also the bachelor student coming, and then now she's in the residency. I hope your well-being is good. Okay, next we go to Mira. Yeah, it's your time. Yeah.
Goedemiddag. Good afternoon, esteemed professors, doctors, colleagues, and ladies and gentlemen. I'm Mira Oktarina. My name is too long to remember, so you can call me Mira. I am representing Department of Dermatology, and I'm representing also my senior colleague, Sri Awalia Febriana. We did our PhD in around 2006 to 2010 and 2015 in occupational dermatology and autoimmune bullous dermatosis. Next, please. Can I help myself? Thank you. So it started in the past with the thesis of the dissertation of Dr. Sri Awalia Febriana with Professor Peter Jan Koenraads in UGM-RUG. She specialized in occupational dermatology, and she continued to have research in contact allergy and drug allergy and also occupational health until now. And she is also collaborating with the successor of Professor Peter Jan Koenraads, so Professor Marie-Louise Kutelaar. They have, I think this is the old version of a presentation. Dr. Awalia Febriana has an ongoing research on finding the hazardous chemical substance in occupational diseases, especially in home industry, so home-based industry. And Dr. Awalia also has now a collaboration with different departments like neurology and I think also pharmacology to find hazardous chemicals and to collaborate also with occupational health in Desa Batik Sehat. It's a Batik village. They have a Batik village to explore more about the hazardous occupational health. And I myself is specializing in autoimmune blues diseases. It started in 2006 with Professor Marcel Jonkman,
he has passed away, the late Professor Yongman. And today I'm doing autoimmune diseases and more here in Indonesia, clinical research on pemphigus and pemphigoid. But in the future, we will have, we discussed about collaboration on exploring more in the pathogenesis and more molecular aspects of autoimmune blues disease. So we may have a PhD candidate and also exchange expertise between two universities, two departments in UMCG and in Indonesia. And we are trying to find a grant or scholarship to support our collaborations. I think that what I can say is Dr. Awalia want to add something more about this Sudadi Sehatus? Please.
Thank you very much. Yeah, actually we already make additional presentation, but not yet appear there in there. But I will show you later in the groups. So actually, the occupational dermatology. So we are working not only with us, but also from ITB, UGM, UI, and also other pharmacy department, and also from the neurology department and everything. And now we would like to solve the problem with making the wastewater treatment and also pollutant water treatment for this one, because we know that the chromium level and metal level is high. Not only batik is already high, but we also have other like industry, like the silver industry and also many UMKM. Yeah, and actually we really want to make this one into the more the apa namanya? Yeah, to the Ministry of Health, to the policy, for the policy brief, because it is really high. So it's make, and we already published also with Peter, Prof. Mary Louise Kutelar for the inventory of the chemical, detailed inventory chemicals, and also there are also group from pharmacology and toxicology, and also from others, and also from pharmacy. And there is a high chromium level, high metal allergy, and then also it's also published also, and our colleague from the Faculty of Chemistry making the wastewater treatment to make to this one, and then from our colleague from ITB, Institut Teknologi Bandung, from the occupational environmental health, they make like a HEPA filter, but for the metal, high metal, something like that. Yeah, and hopefully there will be more.
Yeah. Thank you.
Thank you.
Applause from the group from
Okay.
dermatology. So both of them are alumni from Groningen, and happy to see that you are still contact with your previous department, and then continuing of your publication and doing research together, and hopefully that you can have new students coming, right? Yeah.
Hopefully, and also from other
universities. Yes. Okay. Thank you. Thank you for your presentation. And the next, I don't know, is Morita is already in the, okay. Thank you, Dr. Morita. You are in the Denmark. Are you landing safely? Because you just landing in the Denmark, right? So you still in the airport? Yeah. Okay, thank you. I hope this not disturb your travel. So Dr. Morita will give about TB. Yeah. Please, this is your time. So you, we will run your presentation from here. Is it okay?
Yes.
Yeah.
Thank you so much, Prof. Jarir. Hello, everyone, the distinguished professor, and also all my senior college and ladies and gentlemen. My deep apologies that I cannot attend the event today in person because I need to attend an union conference on tuberculosis in Copenhagen. Yeah, so I finished my PhD in 2019 in the Department of Pulmonary Disease under the supervision of Prof. Chip van der Werf, who is already retired some years ago. But we are still continuing our collaboration, and here in this slide, you could see that there are some people from Department of Pulmonology, Prof. Haup, and my close colleague, Dr. Ono, that I will meet also in Copenhagen the next day, and Prof. Kurt from the medical biology, medical microbiology, also some colleagues from the Department of Pharmacy, Prof. Eric, Marike, and Paul, and also from Faculty of Arts. And from our side, from UGM side, we are consisting of people from Department of Pulmonology, Internal Medicine, Public Health, and also from Faculty of Pharmacy, Dr. Roni Martin. So my field of study is infectious diseases, particularly tuberculosis, and with Groningen, we are trying to improve the prevention, diagnosis, and treatment for tuberculosis through some innovations. And we already started a double degree in Ph.D. in tuberculosis. We already enrolled one student, Dr. Vena Yaladara. She is staff of public health in our faculty. And now she is in her first year, and we also already enrolled another student, Dr. Cynthia Maharani. She was graduated from UGM as well. But she is taking a full abroad scholarship, so not a double degree, but she is under our supervision as well. We can go to the next slide. Okay, so there are some of our current projects. So first, in the terms of innovation for prevention, we are trying to decode or identify what kind of immune protections, biomarkers that someone can have that can protect them from TB, because as we know that some people get infection to TB bacteria, but they do not develop any disease. So by investigating their immune profiles, their protein signatures, then we could reveal what kind of immune biomarkers that protect them, and we can use these biomarkers to develop vaccine and other preventive strategies in the future. In the term of innovation of diagnosis, I actually started the research on electronic nose for diagnosing TB also with Groningen, but now we have this project with Prof. Gers from medical microbiology to diagnose people with TB infection. And this method has an advantage compared to the traditional IGRA method because they detect the proliferation of T cells. And then in the terms of treatment, we are now trying to give the treatment of TB through inhalation because more than 85% of infection happens in the lung. So if we can direct the treatment directly to the lung, then it will be more efficient, less side effects, and give more, and it also prevent the person from the resistance of the TB drugs. So this is a device that is already developed by the Groningen University, by our colleagues from the pharmacy department, Cyclops, and we use them to administer isoniazid and also in the future azithromycin. And then in the terms of the social study, in collaboration with colleagues from Faculty of Arts Groningen, we are now investigating the policy dynamics and social barriers in implementing TB preventive programs among migrant workers, and this is what is done by Dr. Vena Jaladara. And we are using the mixed method research, combining quantitative and qualitative approach. So this is the update of our research, and we are hoping that we will make more collaboration in the future. Thank you.
Thank you, Dr. Morita. It's again happy to see that you still work a lot with the Groningen, even though you've graduated already 7 years ago. And then Dr. Morita received many award and prize from national and international bodies, and for her achievement on TB research. Yeah, so that she's one of our prominent researchers graduate from Groningen University. Thank you, and you still keep it maybe in 10 minutes because we're going to have maybe some discussion. And one last about this topic, it's from our alumni from Veronica. Please, it's from pathology, anatomical pathology department. Yeah.
Yeah, good afternoon, everyone. I'm Veronica I'm a pathologist, especially actually dermatopathologist. And I was graduated from the Department of Genetics in a group oncology, Rolf Simons. And that time I had, my PhD was about the intratumor heterogeneity. And so for each patient, we took multiple tumor areas, and then we compare and then see the pattern of the metastasis and etc. by doing this intratumoral heterogeneity and see the tumor evolution. And then now we tried to establish here, that time we used the NGS, and then we tried to, although it's hard, but we tried to establish doing the NGS here by ourselves. So we make a group here. So we have a group of bioinformatician from the computer science, and then also the students and for the someone that for the library prep. And then we also have the surgeon, and now our current project is about we use the spatial transcriptomics. So we want to expand not only for the genetic heterogeneity of the tumor, but also in the tumor microenvironment. So we will see the interaction between tumor cells and then the immune cell and the stroma. And then we currently using the spatial transcriptomics. So this is the one that one of method that we use. So we use the Physium. So the trick is the slides has the barcodes. So there's many barcodes here. So if we attach the tissue in the slides, and then we extract the RNA, the cDNA, and then it will attach by the barcode, and then we perform the RNA sequencing, and then the result can be mapped back to the spatial location. So we know the gene expression, which cell that produce them, and then in which area of the tumor. So in this project, unfortunately, although I really want to have a collaboration with the UMCG, but we haven't got the match project yet. So we collaborating with the Andre, he's from the Gustave Roussy Cancer Institute, France, and then to do this spatial transcriptomics. And we also have the other collaborator from the computer science, and then also the faculty of engineering, because we develop as well the machine learning to this one. We want to predict the genomic based on the histopathological image using the machine learning. And then we also, because for supporting the tumor microenvironment analysis, we want to by machine learning as well, we want to identify the immune cell, each type of the immune cell based on the H&E slides. And yeah, so this is our current project. For the spatial transcriptomic, we have Physium projects. So basically it's this almost the same. This for the whole transcriptomic in the squamous cell carcinoma. And the GeoMax project, we want to see we want to see the characteristic of the mix of basal cell carcinoma. So differentiation of the tumor should have a different transcriptomic profile. That's what we want to study as well. So we have the collaboration with the Gustave Roussy Institute for that. And then this is the two projects that we have mentioned before. So with the computer science, faculty of mathematics and natural science, we developed the machine learning to predict the genomic profile from H&E slides image of the multiple cancer types. And then with the faculty of engineering, we have the cell identifier project, when we use the machine learning to identify the different immune cell type based on and also pathological tumor parameters on the H&E slide image in the cutaneous melanoma. And this is guided by the immunohistochemistry as well, so that's why we can precisely identify which type of the cells. So I think that's all my projects. Thank you.
Thank you, Dr. Veronica. Impressive for your work. And Dr. Veronica also leading on this type of research in national level. You see, they have a lot of national project. I think that we hope that we can collaborate it with Groningen, right? Okay. So now we have 10 minutes for 8 presentators. So there's a very limited time. So please, if you have some comment or idea, research, yeah, done.
I have a question for one of the first speakers, but maybe actually for my colleague here. The thing is, you know, if you're screening for lung cancer, which is an important disease, using low-dose CT, you might as also look at coronary calcifications, because I think a major killer in the whole world, but especially also in Indonesia, is coronary artery disease. Yeah. Did you consider that?
Yeah. Yeah, because what is screening method available?
Yeah, sorry, I didn't get. So, what is the other one that need to be considered? That you just said.
Coronary heart.
Coronary heart disease, yes.
By looking at coronary artery calcification,
Mm-hmm.
basically you get that also on a low dose CT.
Mm-hmm. Okay. Okay. So in addition to, actually by performing the LDCT, not only we can get the lung cancer detection. In addition to that, also the coronary. Yeah. Actually, I haven't thought about that bonus yet, because the focus in my proposal is for lung cancer, actually. So I'm going to, I don't know, I'm going to consult with my supervisor, even though it's not official yet.
Not official, and also not a cardiologist. So maybe we should consult with him. So it's a sort of bijvangst. Is that what you mean? So in Dutch, an extra, a bonus, a sort of a bonus.
It's a bonus, but it's being used, and it's pretty effective as a screening method for coronary artery disease as well.
Okay. Makes a lot of sense. What it does to our cost effectiveness for the lung cancer, I cannot immediately predict. It depends also on the follow-up on this part. Yeah. So thanks for the comment. You want to add something still?
Well, actually, coronary or heart disease is actually one of the disease priorities that the Ministry of Health is focusing at the moment. So there are 4: cancer, heart disease, and then stroke and kidney disease. So it's actually a good idea to have another separate project, I think, to evaluate whether LDCT beneficial for detecting the coronary artery disease, especially in Indonesian context.
Okay.
Probably because those become priority, so therefore one, two can be detect 2 diseases. Yes. Yeah.
Did Putri already have a topic? A topic? Okay. I see a nice combination of. Okay. While I have the mic, one quick question to the first speaker, which was, I think, on genetics, and I have no idea where. There she is. Any plans to also, because genetic testing, I don't think it's hugely expensive anymore, but there's some costs. So any consideration of doing a cost effectiveness analysis of your approach?
Yeah, maybe for the later project we will discuss about it also.
Yeah, we think there's one chapter of your will be cost effectiveness of pharmacogenetics. Yeah, Viro.
So I also had a question on the genetic study. So you were working with UK Biobank, you're going to work with UK Biobank with Finland. You mentioned 28 patients. That's because that's an estimate of how many of those patients are using the drugs for which you're doing the research, or how do you come to that number?
Okay, we estimate about the number is because we have a previous study that present that some adverse effect related to the myopathy of simvastatin is about some 12% maybe from the total of the cohort study. So yeah, we just based on the previous study.
Thank you.
Thank you. Yeah, Yolanda? Yeah.
Well, I saw, thank you very much for all the presentations. It's awesome work, and I wish you all best of luck with your PhD projects, and I hope you get LPP funding so that you can get started. For the rest, I saw also a lot of, from the alumni, I saw a lot of connections, because we do actually very comparative research in the Netherlands as well, or in the UMCG. So on the TB part, I think, I wasn't sure whether Siha mentioned the collaboration with the Department of Medical Microbiology and the UMCG, but the UMCG is the reference center for tuberculosis. So at least the wish, there is not so much research ongoing at the moment, but there is a strong wish to actually develop that research. So in that sense, it might be nice also because we have a new department head coming in, Joost Hopman, and he will be very interested in developing this further.
Yeah.
And then for the spatial transcriptomics and the single cell, I don't know, you are here in the back. We have also a very a group within the UMCG, which is headed by Floris Foyer in the ERIBA Institute. Oh, you know him already, yeah.
No, I have one paper with him, single cell that time.
Ah, okay. Yeah, no, excellent. No, yeah, then you already identified the overlap yourselves as well. Yeah, that's what I wanted to add at this point. Thank you.
Thank you, Yolanda. Dr. Morita, are you there? Are you working with the Department of Microbiology from UMCG?
I'm working with the Department of Molecular Microbiology with Prof. Kier.
Okay.
But yeah, it will be wonderful if I can also work with someone from microbiology department.
Yeah. Okay, so we're going to link you with the Department of Microbiology in UMCG. Yeah. Thank you.
Thank you.
Yeah.
Thank you.
So, yeah. Okay. Uri?
Yeah, thank you very much, Prof. Jarir. My name is Bustanul Arifin and I'm from Makassar, South Sulawesi. I would like to ask Mbak Icha, Dr. Icha, if I understand correctly that you did your study, you combine the design quantitative and qualitative study. I would like to ask you about how you develop the qualitative study? You start from the quantitative and then after that you try to explore more, use the qualitative study, because I read your publication for the qualitative and it's I like it because it's a simple thing but you can describe it into detail. So would you like to tell us about that?
Thank you very much,
thank you.
Dr. Uri. So I actually did in the opposite way. So I did the qualitative study first and then continue with the clinical study and also the clinic cost effectiveness analysis. Because at that time the funding was first coming for the qualitative study and it requires less participants. It was pretty much more feasible and efficient to do in the beginning of my PhD project. So I finished that first and I get the idea of how this screening project is implemented in Indonesia. So and then I continue with the more complex things with the clinical and cost effectiveness analysis.
So on the simulation, who presented on the? So maybe to mention, we actually got a large research grant in the Netherlands on simulation for education, and we're also building or constructing a new simulation center based on mock-up rooms that we use to build the hospital. And the person leading that, I don't know whether you, is Laurens Reinke. I don't know whether you know, but that would be a good contact point between our simulation centers, I think.
Yeah.
Yeah.
Okay, now you have a contact person. So, thank you very much. I think, I'm sorry, because the time, we need to limit it, and now it's already 4:30. We have to continue for the next, from the Faculty of Dentistry. They're gonna have a 7 presentation. And I give the moderator to Dr. Andri Zande. Yeah.
Yeah, thank you, Prof. Jarir, for all of the arrangement of this symposium. On behalf of Faculty Dentistry, I would like to give a brief introduction about the persons who will deliver the presentation today. So we have a 7 presenter. One is from our research group. That's a alumni who would like to collaborate research collaboration with Groningen, and 2 current students. They already registered in the doctoral degree in Faculty of Dentistry in the scheme of joint supervision with Prashan Sharma from the BBT, and hopefully with the Prof. Eugene Ray from Orthodontics Department. And then we also have 4 future students, and at this moment, we really hope that they can find the supervisors for their intention. Yes, thank you so much. Please, Dr. Sandy.
Okay. Okay, good morning. Good afternoon, ladies and gentlemen. Good afternoon, ladies and gentlemen. I think it is a very tired and a very exhausted day, but I think we feel the same situations, but still curious. So I think we have to be relaxed now, deep inhale and exhale, because it's a very, very, very wonderful days. So welcome to our story. This is the journey story from our Faculty of Dentistry. Maybe it is a very beyond stories, I think, and a very fascinating and also fantastic scientific thoughts today. And as you know, for the previous introduction from our Vice Dean of our Human and also Resources and Development, we will have 7 presenters, and it will be represents of our Center of Excellence in our Faculty of Dentistry. So, at the first presenter, this is from Dr. Suci. Dr. Suci is from Alumni from the Groningen University. So I would like to tell you a story about this. Many people don't realize that problems in the mouth can quietly signal bigger health issues in the body. So today's first topic helps us understand that connection. Dr. Suci, please welcome oral health and non-communicable diseases. It will be getting relaxed. Please give applause for her.
Big up.
Terima kasih. Good afternoon, everyone. Yeah, thank you very much for the time, and yeah, I hope not make you tired because it's quite late. Yeah. Today I'm presenting some colleagues from dentistry, alumni from Groningen University, and but there are maybe 2 that will join with our group research. This is the research that we will propose to Groningen, and before we have discussed it with our previous supervision, Prof. Aryan Fishing and Prof. Johanna Wenstra from Immunology Department. Yeah, and this is the title that we bring up about that. Okay. Yeah. Yeah. I think all know that the non-communicable disease is a global problem, not only in Indonesia, but I think also in Groningen and also in Netherlands. Yeah, and right now I think the connection between the oral disease and the non-communicable disease, many research have revealed that there is connection about that. And but the problem, I think, we want to reveal what the problem in oral cavity that maybe we can develop to identify the marker that we can, so we can prevent or identify early in that problem. Yeah, I think it's not no problem. Yeah, and luckily because our government, we have actually also concern about the problem non-communicable disease, and we have two program we call Post-Bindu and Prolanis, where in Post-Bindu actually it's program that target for the person that have no problem with non-communicable disease, and they routinely come to that program regularly in 3 monthly, and a government through the primary health service doctor, they will check the glucose and then the uric acid, also the cholesterol, something like that. And beside that, they also there is education in the Post-Bindu also, like exercise that routinely also be done there. Yeah, and if in the Post-Bindu the person is identified have problem with the non-communicable disease, they will be moved to the program Prolanis. So the Prolanis is the program in which the target was person with non-communicable disease. Yeah, it is also government through the primary health service also routinely check the blood glucose and then cholesterol and then uric acid, something like that. Yeah, and this is so we will focus in the Post-Bindu because we want to know when someone have identified with the problem, the non-communicable disease, what happened in the oral cavity, and we will sorry. Yeah, this is the criteria for the person in Post-Bindu. Yeah, if someone will identify that, and then they will move to the Prolanis, and then the doctor will treat them in the Prolanis program. Yeah. In the last research in Indonesia done by our colleague from medical faculty, it's identified that there is some modificable and non-modificable disease that influence the problem of non-communicable disease. But unluckily, because that research not include the oral health, so that's why we interested in the oral health as a risk in the non-communicable disease, and we will take the sample from the saliva, and then also we will check the caries, also the periodontitis and all lesions that happen in the oral cavity, and then we will also search about the marker, even though now we still in progress discussion related with what the marker that we can identify to know a person when they early identified with the non-communicable disease. Yeah. Yeah, so the aim of our research, generally we want to evaluate the relationship between oral health status and the risk factor in non-communicable disease. And maybe specifically we identify oral health profile in individual identified early as being at the risk of non-communicable disease in the post-PINDU community. Yeah, the method study, this is the prospective longitudinal cohort design. Yeah, and then we implement it in the post-PINDU program, and then we will follow up in 3-month follow-up, join with the government program, and then we also will recheck at 6-month follow-up. So hopefully in that period we can able to identify what significant marker that we can identify in that.
Pardon, Dr. Suci, 2 minutes left.
Okay, yeah. Yeah, yeah, and we will implement in the one of the district in Yogyakarta. Yeah, yeah. Then, yeah, I think it's sample size. Yeah, I think it's this is the research planning that we have discussed with the promoter from our promoter in Groningen. Yeah, so we focus in this site in post-PINDU, yeah, and so it is still open for Ph.D. candidate when will join this research, yeah, with the character. Yeah, I think it's enough, yeah, from me, and maybe Dr. Tita will. Oh, no. Yeah, because the colleague that involved in this project, I think all have the specific expertise related with that. Yeah, okay. I think it's all from me and us. Yeah, okay, thank you.
Okay, thank you very much, Dr. Suci. That was very insightful presentation. Ladies and gentlemen, when gums are damaged, most people think they can never grow back. But modern dentistry now offers ways to help tissues heal, almost like giving the gums a second chance. Ladies and gentlemen, this is regenerative periodontal therapy. Please welcome Dr. Mentari.
Good afternoon, everyone. PPT-nya belum ditampilin ya? Okay. As we wait for my presentation to open, so I would like to introduce myself. My name is Mentari Salmanweti. I'm a lecturer and also periodontist from Department of Periodontology, Faculty of Dentistry, Universitas Gadjah Mada. In this occasion, I would like to share about what I did and what I'm currently doing and about my future plan. This is my field of study, mostly regenerative periodontal therapy, periodontal regeneration across biomaterial, bioactive, and implant surfaces. Oh, it's a bit messed up. So as a periodontist, I routinely manage moderate to severe periodontitis with horizontal and vertical bone loss. I also have experience in regenerative surgery, GTR, bone graft, IPRF application, also dental implants. And one of the biggest challenges in maintaining growth factor stability, especially IPRF, which often resorb too quickly during healing. These repeated clinical observations are exactly what motivated me to focus my research on scaffold-based enhancement of IPRF. This is my research about chitosan PVA nanofiber loaded with IPRF. My past research, it's already done during my specialty training. And during my specialty training, my goal was to develop and characterize a scaffold that could successfully deliver IPRF. Me and my team, we fabricated electrospoon chitosan PVA nanofibers, immersed them in IPRF for different duration, and evaluate the material through swelling tests, FTIR analysis, and cytotoxicity tests with MTT assay. The key finding of this research was optimal swelling at around 10 minutes, meaning the scaffold became well hydrated and porous, which is ideal for absorbing IPRF, and the FTIR confirmed physical bonding only, so the scaffold chemical structure remained intact, and also the scaffold show over 90% fibroblast viability, indicating that it was non-cytotoxic. From this study, I conclude that the chitosan PVA nanofiber is safe, stable, and observant scaffold suitable for periodontal regenerative application. And building on that foundation, I have a project titled Toxicity Proliferation of IPRF Embedded in Chitosan PVA Nanofiber. It is funded by UGM Damas program. The research focus on embedding IPRF directly into nanofiber using a simple care site friendly method. The aim is to create a scaffold that clinician can easily prepare and apply during routine periodontal procedures. Right now, my objectives are to assess cytotoxicity, measure fibroblast proliferation, and evaluate whether this scaffold IPRF combination is feasible as a regenerative membrane that can maintain IPRF stability for a longer time. This was a little project that I did with my undergraduate student for their undergrad thesis. It's called Helbel-based adjuvant for scaling and root planning. With the objective was develop Altlingera elatior, or we call it kecombrang extract gel, as adjunct to scaling and root planning.
Left.
Okay, so because the limited time, I will continue to the future research direction, which is bioactive and regenerative implant surfaces. So building on my previous work with chitosan PVA nanofibers and IPRF, my long-term research direction expand into bioactive and regenerative implant surfaces. My earlier research focused on how scaffold can stabilize growth factors, prolong their activity, and create a more favorable microenvironment for regeneration. The same biological concept can be translated into implant surface engineering. Clinically, especially in patients with periodontitis, we need implant surface that not only integrate but also actively promote bone formation, soft tissue attachment, and reduce inflammation. My long-term vision is to bring periodontal regenerative principle like controlled release biomimetic scaffold and growth factor stabilization into dental implant surface design. And also the surface treatment focus includes nano and micro texturing to enhance osseointegration and develop bioactive coatings that build directly on my previous work. For example, coating that incorporate IPRF or chitosan-based layers. The potential approach connect very naturally to my past experience, immobilizing growth factor or peptides onto titanium or zirconia surface, similar to how I embedded IPRF into nanofibers. Also applying bioactive chitosan-based nanofiber or hydrogel coatings into implants or abutment surface, combining antimicrobial and regenerative surface modification, which is relevant for periodontitis susceptible patients. And my overall goals is to develop cost-effective bio-inspired implant system that promote faster, more predictable bone and soft tissue regeneration, especially for patients in developing countries where affordability and accessibility are major concerns. I think that's all for my presentation. Thank you for...
Thank you very much, Dr. Mentari. That was very insightful presentations. And to move forward, ladies and gentlemen, I would like to tell you a story. We all have different saliva, diets, and bacteria in our mouth, just like fingerprints. This difference is actually affect how well certain treatments work. So, ladies and gentlemen, please welcome Dr. Eva. She would story about biological profile and remineralizations. The time is yours, Dr. Eva.
Thank you very much, Dr. Sandy. Good afternoon, distinguished colleagues and delegates from the University of Groningen. My name is Eva Mardiah from the Faculty of Dentistry, Universitas Gadjah Mada, and I'm at my first semester of doctoral study program in dental science. So today, I will briefly present my outline research, doctoral research, which intersection of the public health, biomaterials, and also precision dentistry. It will focus on understanding how biological diversity, especially salivary profiles, will influence the effectiveness of bioactive remineralization agents. And this study is positioned in, within the broader goals of developing a more precise and personalized approach to caries prevention in Indonesia. Okay, so in Indonesia, dental caries remains a silent but pervasive public health problems, affecting more than 80% of the population. And beyond dental pain, it contributes to reduced chewing ability, poorer nutrient intakes, and chronic inflammation, and also ultimately may worsen the national issues such as malnutrition and stunting. And also, dental caries contributes to decreased students' attendance, learning performance, and also productivity, linking oral health directly with the development and also quality of our future generation. So, although the governments already measure preventive measures such as like mass toothbrushing program, fluoridation initiatives, and also the 2021 national clinical guidelines for caries management, but current strategies still implies uniform recommendation to highly diverse population. Indonesia has a very wide biological and behavioral variation, such as difference in diet, salivary composition, and also buffering capacities, and like oral microbiome also. This variation will determine the individual caries risk. Yet they are not incorporated to today's prevention approaches. So this create a clear research gap that we do need biological evidence that links the differences that the differences to the effectiveness of the preventive materials. So my doctoral research aims to identify distinct salivary phenotypes in Indonesian adults, and based on pH, and then flow rate, buffering capacities, and also calcium phosphate content and carriogenic bacterial load, and examine whether these phenotypes will respond differently to the preventive materials. And this will be the first foundational steps to future predictive algorithm of personalized caries prevention. This study designed visible within 1 year. For the months 1 to 4, we will collect saliva for about 100 Indonesian adults.
2 minutes left.
Okay, thank you. For about 100 Indonesian adult saliva, and then comprehensive of phenotyping there, and then after that we're going to the in vitro study. With applying the Sp.PA as a currently used bioactive material remineralization, and then to the different salivary phenotypes that's already characterized previously. And then for the months 11 to 12, we will perform the micro-hardness testing, semi-DX analysis, and etc., comparing the remineralization outcomes across the between the groups. And this research study is planned to conducted under the supervision of Prof. Prashant Kumar Sharma from the UMCG. And I believe it closely aligned with his expertise in biomaterial and biointerface mechanism, especially in understanding how the materials behaving between the different biological environment. And I also hope that this research will be the basis for long-term collaboration between University of Gajah Mada and University of Groningen. And I'll look forward the opportunity to work under Prof. Sharma and the MCG team. Thank you very much for the attention.
Okay, thank you very much, Dr. Riva. I think it's very high results for students in this PhD next year. Okay, ladies and gentlemen, I hope we will stay with warm discussions. So I would like to call for the next presenter. Imagine being able to test a surgery on a virtual copy of your own jaw before doing it in real life. That's the power of digital twins. Ladies and gentlemen, digital twin for mandibular implant reconstructions with Dr. Gabriel Aryo. The time is yours. So please give applause for him.
Check, check. Good afternoon, everyone. Thank you for having me time for presentation. My name is Gabriel Aryo Wicaksono. I'm from Biomedical Engineering, Universitas Gajah Mada. And this is my topic, my future research topic about develop of a biomechanical model for mandibular implant. I'm currently looking for PhD program and still discuss the specific focus topic for my PhD program together with Dr. Suci and Dr. Dedi and Prof. Max Wijes from Groningen. Okay, I'm currently identified the key challenge in this study. First is mechanical property mismatch, stress shielding. The implant bears most of the load, debriefing surrounding bone of mechanical stimulation and bone resorption around screws, leading to screws loosening and reconstruction failure. And the second is implant tissue interface problem, is oversized implant with sharp edge or suboptimal surface characteristic, and implant stiffness and geometry irritate surrounding the soft tissue, and inflammation, tissue staining, and implant exposure to the oral cavity increase the infection risk. And the third, manual designing process is limitation. Each patient unique anatomy requires a personalized or individual's implant dimension, and slowly, costly manual design takes weeks and demand expert resource, and not integrated, difficult to manually incorporate complex biomechanical data, and potential for truly optimized design is often lost due to tool and time constraint. This is the workflow. We get the patient data from CT scan and then segmented the functional profiling and smart and automated design, and then automated the finite element analysis. And then the output is to print the 3D model implant. First is biofunctional profiling. This is the CT scan image, and we need to segment the mandibule with tumor invasion from CT scan, and then after get the segmentation from the mandibula, we develop a fast method to segment the soft tissue from the CT scan. And after that, we create the surgical planning with computer vision to determining the optimal position before surgery. From this data, we can get the dimension and can draw and create the 3D model of the implant. And then we collect the a lot data to simulation and get the data to create the automation with training artificial neural network to predict the biomechanical performance of the implant or the prosthesis.
Pardon me, Arya, 2 minutes left. Okay, thank you.
Thank you for this is
really
this is
okay.
Still a scratch.
I would say apologize in advance because we have so tight time. I'm sorry, but we have deep discussions after this. Don't worry, okay? Okay, ladies and gentlemen, please give applause for Arya. Arya is one of our students in biomedical engineering. It is your first year, right? How many? Second year. That's very excellent. I think he will be a high resourceful students in the future time. Okay, thank you so much, Arya. I'm sorry I have to remind you about the time, but it's okay to have deep discussions after this. Okay, ladies and gentlemen, next presentations will be fascinating things also. So after braces, so we will have our orthodontist now. Okay, so after braces, many people worry their teeth might shift back. Today's topic explores a material design to help keep the smile stable. One of our orthodontists and our pride of our faculty, Dr. Aulia, the time is yours. I would like to remind you 5 minutes approximately to finish, so thank you. to reduce the nervous. Maybe give applause for him. Okay. You can do it, yeah.
Good afternoon, everyone. Please for the slide.
Okay, the committee, would you like to kind of assist us because the technical previous slide, I think. So the committee, would you like to kind of assist us so for the technical matters here? Okay, it's okay, Auli. It's okay because no words in previous screen. Yeah. Is it your slide now? That's correct, Oli? Okay.
But our first slide is blank. Okay, it's okay. Okay, good afternoon, everyone. My name is Aulia Ayub. I am the lecturer at the Orthodontic Department, Faculty of Dentistry, Universitas Gadjah Mada. I am also the student of the doctoral study program in Faculty of Dentistry, Universitas Gadjah Mada. Okay, I would like to present. Okay, so the title of our slide in the first slide. Okay, maybe I would like talk about our research background because of malocclusion. So malocclusion is one of the three major of oral disease, and the prevalence of malocclusion is in Indonesia is very high, until 80%. And the use of orthodontic appliance is very high demand in society. And for the orthodontic appliance, it's divided into two phases. First in the active phase and the second in the passive phase. For the active phase, the patient will use the orthodontic appliance such as braces, such as aligner and others. And for the passive phase is for the retention. For the retention phase, the patient can use retainer. But, however, the successful rate for the passive phase is very low because the teeth will gradually back to their original form before the orthodontic treatment, which is called orthodontic relapse. So the orthodontic relapse has the high prevalence. It's about 33% until 90%. And the relapse occurs due to non-compliance is approximately 90%. And in the bone remodeling can be about mineral deficiency, osteoblast activity is decreased, and alveolar bone remodeling is also decreased. And nowadays, retainer is purely mechanical, and outcome is highly depend on the patient compliance. So we need the additional biological retainer is very required for this case. And our plan, I'm sorry, is for the technical issue for this PowerPoint maybe. Yes, maybe in our future plan research is using development of carbonate hydroxyapatite base for the formulation for biocompatible gel, which will be used for the local application for orthodontic treatment. And our research design is research laboratory, composed material for biological retainer, and our research study is for orthodontic, biomaterial, biomedical engineering, and biotechnology. And our research plan is using in vitro study, in vivo study, make a prototype, and in the end, and after a few years, we hope we can make a product for the topical gel, maybe for the relapse prevention. So for increase the stability and reduce relapse It's maybe for clinical benefits and for implication for the society about the relapse. Okay, this is our urgency, novelty, and this is our originality. And after that, this is our research roadmap from now until a few years ago. Okay, thank you very much. I'm sorry for the mistake for the technical issue. Thank you very much.
Okay, thank you very much, Dr. Auli. Even though you have found your technical issue, but I think your presentation was insightful. Thank you, audience, for stay engaged today. Now you know that we are having so many tasks and works in just 2 topics. So after this, we will still have a next presenter before you saw our orthodontist. So next we will see for the performance our prosthodontist soon, right? Because now he is studying at the special study program of prosthodontics in dentistry Universitas Gadjah Mada. Ladies and gentlemen, in the past, designing facial prosthesis required many sessions and adjustment. Now, digital tools can guide the process with more comfort and precision, right? Dr. Rino, digital maxillofacial prosthesis design. The time for Dr. Daniel Rino. Give applause for him.
Okay, good afternoon everyone. My name is Daniel Rino Krismasurya. You can call me Rino, and this is my face when you see it on the picture. Yeah, this is me when I was handsome. Right now, I'm not so handsome. Yeah. Yeah. Okay, right now I am a 3rd year student at the prosthodontic department, and then now I will present how the digital technology in the transform from the planning, design, and the simulation of maxillofacial prosthesis. So this is the field where the precision meets comfort in the patient. So maxillofacial prosthesis is the artificial intelligence to replace the anatomical structures that cannot be surgically reconstructed. So it will manually or artificially designed by hands to replace, such as ear or nose or cheeks or chin, like that. So the prosthesis restore the function especially, but for when the eye, we cannot use it for the function. So it's just for aesthetics. So when the function and the aesthetics is combined, it will affect the patient well-being, the quality of life. And then for the modern maxillofacial prosthesis, we use the biocompatible materials, especially the medical grade silicone, acrylic resin, or titanium frameworks. We use it for replacing the condyle or the mandible. And the digital technologies is using with the 3D scanning, CAD/CAM, and rapid prototyping and medical imaging. So we combine the extraoral capture and then the CBCT imaging, and then we design and simulate the maxillofacial prosthesis. So this is the, I'm sorry for the disturbing pictures. This is the example of the maxillofacial prosthesis. So it can be in the outer of the face, or maybe in the oral. Yeah. Yeah. So when we use the digital imaging or digital dentistry, we have the digital workflow integration from the CBCT and the extraoral capturing, and then especially we can use the virtual surgical planning, so it can reduce or we can minimize, and we can planning with precision where the areas that we need to cut, we need the areas we need to cut and we need to take, and we can also get the prosthesis immediately after we cut it. And then the important one, we can have the long-term documentation, and we can reproduce the prosthesis. Usually the prosthesis is broken or it was damaged, and we can reproduce it immediately after the patient comes.
Pardon me, doctor. 2 minutes left.
Okay, thank you. Yeah, so we highly use the digital over conventional because some defects are too big or too complex, and we need the digital to make it symmetrically or aesthetically possible. So the case that I use is for the ear. This is I have done, but it's not over yet because I still searching for where the silicone print is we can make. This is the patient. He has extracted the ear because of the nasal tumor, and then this is the one that I have created. And then in other cases, I use the digital technology to examine the medical properties, the material properties, and this is one that I have researched it for the fractural strengths. And we examine it when the post-curing treatment. Yeah, and this is also the one that I create for the patients in the Sarjito. Yeah, thank you for my presentation, and Danke. I'm sorry.
Thank you very much. So very fantastic scientific talks. Thank you, Dr. Rino, for the insightful presentation. So audience, thank you very much for staying engaged. So we have last speaker today from the Faculty of Dentistry. I think he is one of the resourceful student also, because he is now resident in orthodontics, right, Dr. Arya? Okay, clear aligners seem simple from the outside, but even small design features can make a big difference in how teeth move. Trimming lines in clear aligners, finite element analysis study. Please welcome Dr. Arya.
Thank you. I would like to begin by thanks all professors and doctors and colleagues from the University of Groningen and Universitas Gadjah Mada for joining this session. So I'm Putra Ramadan from postgraduate specialist program in orthodontics. This presentation is titled From Virtual Forces to Real Smiles, a research journey and future directions in clear aligners biomechanics. So this slide introduces the background and the research gap. The complex canine morphology generates inherently low moments, force ratio, making rotation biomechanic inefficiency in everyday clinical practice. So the biomechanical limitation of the clear aligner therapy, we miss additional features like attachments, devote, and trimming line. And the clear aligner therapy consists of strategy to rotate maxillary canine, which is one of the most persistent biomechanic challenges in digital orthodontics. So our present work, its thesis project, the study investigates the exact biomechanical impact of default force systems and trimming line designs on canine rotation. The simulation systematically tests default variations and trimming geometries, capturing changes in rotation moments and stress distribution. and the analysis generates genetically translatable insight, enabling orthodontists to design smarter and more powerful aligners. So the our finite element workflow. So the model originates from the patient's specific and CBCT dataset, and the periodontal ligament is modeled with non-linear properties, and then the multiple design configuration under identical rotational displacement, blend and control comparison. So while bridging the finite element analysis guided design into the clinic, so several project stage design control clinical studies comparing conventional aligner and the clinical workflow connect internal scanning or CBCT, standardized finite element templates, in-house aligner manufacturing, and three-dimensional superimposed outcomes. And so the key evaluation focus on rotational predictability and the number of treatment state, side effects, and patient report experience. So resulting clinical data inform foundation rules on indications and optimal combinations on default and trimming lines in everyday practice. And then long-term visions and collaborations, and the operator vision integrate finite element analysis outputs in vitro measurements and clinical result into predictive models and patient-specific default and trimming line configurations. And so the future development target is planning module or plug-in for in-house aligner systems and strategic collaboration support with market of postgraduate training and multi-centers, clinic studies, and share perform the digital orthodontics and clear aligner biomechanics. Okay, thank you for your attention.
Okay, thank you very much, Dr. Arya. That's very, very, very interesting. Okay. Ladies and gentlemen, this is your time today, so I would like to give the audience first. Maybe we will have remarks or something like feedback. Yeah, Dr. Moniz. Sorry.
Thank you. Thank you for the very nice presentations. I think I already talked to, all of you in the morning, so we already had some nice discussions. I think that Yolanda can also help me here, but maybe the matches are already quite well done, which is very nice and advanced, let's say. So Professor Prashant Sharma will be a very good one for the first projects, as I mentioned, of the salivary and also biomaterials more focused for that area. And also for the maxillofacial surgery will be Max. I think you are also in touch with him already. His team, they do a lot of nice work about that. Not only design, but modeling as well, mechanical properties, simulation, and 3D printing. And after they checked that, they came to visit our lab 2 weeks ago. By coincidence, we discussed a lot, so they are doing a lot on this area. So I would recommend these two teams. I don't know if you have anyone else in mind at the moment.
No, I think you already identified the main leads, let's say, within the UMCG, and I am happy to see that it's going so productively. Yeah.
Okay, thank you. So here we have 4 future students, and I think all of them talk about or discuss about the digital dentistry, something like that. So perhaps in the future, as Prof. Jarir also tell me that we all have to have a timeline, yeah, Prof, who is the supervisor that meets with our future student to study in Groningen. So thank you very much, Prof. Yolanda and Moniz, that we can discuss further. And this morning, our group also already discussed with Prof. Viro about the possibility to collaborate with the digital, kind of finite element analysis, and etc. But we need the expert from the Faculty of Dentistry, to have a more complete picture about this research. So we continue to discuss through Zoom or email, something like that. Is it okay? Yeah.
Also for the dentistry, we can try to guide you inside.
Yeah.
I don't know names by head now, but I'm sure I can find out when you contact me or someone can help me.
Yeah.
But also for the microbiology part involving the dentistry as well, we also have in our department Dr. Brando, and can also.
The Brandon, yeah. Okay.
So yeah, Brando, you know very well.
Yeah. Okay, thank you. So it's clear for all of you, yeah? Yeah, okay. Yeah, thank you.
Thank you very much, Doctor and Professor today. Is there any else for the audience first? Okay. Is it time limit for the committee?
Just 10 minutes.
Just 10 minutes, okay. Okay.
Yes, actually.
Okay, I would like to say to appreciate with departments here because now we will have Dr. Triana. What you tell me? Okay. For the vice dean, for the research, do you have any some kind of feedbacks? Okay. Okay, thank you so much, Dr. Mami. Was very supporting us today, and also we have Dr. Tantan Chandrawasi. She is the head of Department of Orthodontics. She is very energetic and powerful leaders in orthodontics. So that's why we have two students here to present the research. And also my best prayer to you all, and wishing more success for all the students who are ongoing research project here. Thank you very much. I think for these last sessions, and I would like to give the time back to the Master of Ceremony or Professor. Okay. Thank you so much.
Yeah. Okay. Thank you very much, colleague from dentistry. I'm happy that you have a very good matchmaking today, and then there are so many students candidate, and you already find us, and then continue. Yeah, we're going to continue one still on discussion. Who are gonna be supervisor from Gorengan University? We can continue, but the important as well is about because I know some of you are still resident. And then you still need to finish your residentship, and then you need to also have timeline when you're going to start it for your Ph.D. Yeah, so that's important to communicate it with colleague from Groningen, so they not expect you maybe in the coming months or something like that. You know, something we need to discuss about it. And I like also to thank you for all colleague from Groningen University. Thank you very much, and from deep of our heart for your coming to Indonesia and then to collaborate it with us in the southern part of the world, and then you are very northern part of the world. And thank you very much. And then I think the last 2 days is very fruitful discussion, and we have we have like already click here that we know that we are the same interests, and then we have also the same purpose. Yeah, so that's important. And then also thank you very much for all three participants, presenters, audiences from Faculty of Pharmacy are still here, and then Faculty of Public Health, Medicine, Public Health, Nursing, and also from Faculty of Dentistry, as well as all the alumni is from other university who come also in this occasion. Thank you very much. And for closing, hope that our meeting today and then yesterday also will benefit for all collaboration in future collaboration for us. Thank you very much for all committee from Faculty of Medicine. Applause for them, because they are prepare everything. You know, we have a lot of discussion in the last couple months, you know, to discuss about the agenda, invitation, logistic, etc., and also our staff from the IT who are handle this very well. Thank you very much. And I close this session. You want to say something?
Yeah, just also wanted to thank you and all the people involved in the organization. So we learned a great lot this afternoon. It was very information dense. It was really great to see how much is already going on between our institutes and also the potential that is possible. So thank you all for your contributions, and we really look forward to strengthen our already great collaboration. Thank you.
Yeah. Thank you, Prof. Biro. Thank you. Please give applause for all of us. Thank you very much. And I'm close this session, and then the dinner waiting outside. Dinner. Yeah, please enjoy the dinner. Thank you.
Yeah, thank you, Professor Jarir. And yes, ladies and gentlemen, the dinner will be provided by the Faculty of Medicine, Medicine and Public Health and Nursing, University Gadjah Mada. Thank you again for your coming, and then I hope you all enjoy all of the activity today. Hopefully, in the future, we can meet again on a different beautiful occasion. And see you again. Wassalamualaikum warahmatullahi wabarakatuh. Have a good night.